Assalamu alaikum. Do you hear my voice very clear? My voice is it clear? Yeah, assalamu alaikum. Shukran jazeelan lakum. Thank you very much for confirming. I really appreciate it from the bottom of my heart. Thank you. Okay, my name's Ahmed Abu Jabir. I'm a certified professional healthcare quality. I'm certified professional patient safety. I'm certified professional healthcare risk management, and also certified Six Sigma Black Belt. It's my pleasure and honor to start, talking about leadership in healthcare. This is a course is a 4 days, today and tomorrow, and after tomorrow, and until Monday. So we'll start right now, and we'll end today at 11 o'clock. This is, the timetable of the leadership. However, we'll start from 5 p.m. until 6 p.m. leadership and overview. And then we are going to talk about leadership roles and responsibility. Then we'll have a small break, 15 minutes, just a prior break. And then we'll talk about change management, and we'll have another break, 15 minutes, and then empowerment and leadership techniques. This is the whole activity that we are going to tackle today. This is for kind of informations. So the outline that we are going to tackle: leadership concept, definition, style, leadership versus management, and leadership and communication, problem solving and decision making, and leadership and management of change. This is the course overview of, as objective. We are going to define what is leadership is and how to apply it in all level of organization management. And we need to understand the basic of leadership and motivation, and determine what is necessary to lead the teams and organization, and how to integrate this with work management, develop skills and communicating and influencing and negotiating with peers and subordinate and senior managers. This is all about objective learn how to develop leadership in ourselves and others. And moreover, we need to understand the leader role and organization and quality improvement, understand the key success factors for successful rollout of management of change in dynamic organization, and learn how to motivate self and other, and understand the importance of planning for the effective leader. So let's start with the leadership. Before we start, I want to comment. No need to write your name right now. It's already, once you are entered the webinar, you are going to be recorded in our Zoom. So no need to write your name. I really appreciate your help in this matter. For no need to write your name right now. Just only once you enter the Zoom, everything will be recorded by your email. Thank you very much. Yeah, before we talk about leadership, and I would love to talk about the leadership challenge. This is for Kozner and Posner, one study leadership science. They did a study in leadership science considered as a reference in leadership. This study continued for 40 years, and the sample was taken 3 million. Imagine with me, the sample is taken 3 million over 40 years, and the accuracy of this study is 97.5. And you will never ever find such study with this kind of accuracy. And this study, they are asking one question: what is the characteristics of the exemplary leadership? What is the characteristics of the exemplary leadership? In Arabic, we call it ما هي صفات القائد المثالي. يعني سألوا سؤال في دراسة، وكانت دقة هذه الدراسة 97.5%، almost 3 million they participated in this study, and they asked this question: what is the exemplary, or what is the characteristics of the exemplary leadership style? And here, by the way, the leadership challenge doesn't mean the translation of this. They call it al-qiyada tahaddi. And guess what? Number one, and once they are asking this question, what is the characteristics of the exemplary leadership style? And every 2 years they release the result. And number one, they have they agreed, around 70% of the people who participate in this study, they agreed number one is to have a credibility. And they ask, what does it mean, credibility? It means to be honest and credible. That's our Prophet Muhammad. They call it as-sadiq al-amin. So do what you say, and this is the definition of credibility. Do what you say that you will do. Do what you say that you will do. So we need walk the talk. We don't want talking. So people, they believe that characters of the exemplary leadership is, is a credibility. To be honest, okay, do what you say that you will do. Al-Qa'id al-Sadiq, we call them. Now, this is what we call the Cousins and Posner. And actually, I'm always start with that study because it's considered as a reference in leadership. So any study comes in leadership, they compare it with the Cousins and Posner study. Okay, let's proceed. You see here in 1987, number one is honest. In 1995, number one of the characteristics of the admired or the exemplary leadership is honest. And 2002 is 88% the answer honest. And 2007, 89% the answer also honesty. And 2012, the answer 89% is honesty. So this is what we want. We want from the leadership to be honest. So yeah, the majority of the constituents believe that the leader must be honest, forward-looking, competent, and inspiring, and that's actually the foundation, and the foundation for all the humanity that they need. They need leader who is honest, who need to do what you say that you will do. That's the credibility means. So now I would love just to ask you your question. What does leadership means to you? Anyone have any, just you can just participate in chat box. Just answer me. What does it mean, leadership, from your point of view? Latifa, yeah. Yeah, you're right, guys. Just please don't write your name and your because again لو سمحت يا شباب ما في داعي تكتبوا الاسم والرقم الهيئة. فقط انت لما تدخل بالاسم يتم التسجيل الان. خلاص لما تدخل انت بايميلك فاوريدي معلوماتك كلها موجودة عندنا. فشكرا جزيلا لكم يا جماعة. Yeah, leading by example, competent, the ability to be a role model that everybody else will follow. Leading, oh, good, great. That's really good. Yeah. Responsibility, organizing, Yusuf, leading, fostering, assistant, and guiding. Until this moment, no one answered me actually the leadership is. This is all what you are talking about is characters. It's not definitions of leadership. Teamwork, okay? Empowering, define rules for everyone and working together as a team. Nasreen. Dana, to inspire, okay. Rehab, managing. منصور إيجاد الحلول وإنصاف الموظف المجتهد وإخراج كل ما بجعبته. Thank you. That's good. Okay. Improvement, to guide the team. Managing small group and to be questioned. Strategy. Okay. Fine. What else? Until this moment, no one answered me exactly what is the leadership as. Yes. Yeah. Leading a group and the organization, how to manage yourself. They will take responsibility and handle tough matters. بدر. تعزيز الثقة، تأثير على الإبداع. Actually, what all you are mentioned, it's characteristics of the leadership. It's not actually the yeah. Someone answer. Yes. Yahya. Yahya, he said how to influence the others to actual mutual objective. Thank you, Yahya. Thank you very much. Actually, leadership. Leadership, the word that I want is influence. His influence others. Okay, this is the leadership as. The leadership is about to influence people. Maybe because his charisma, maybe because his nationality, maybe his way of talking, maybe he admire people. People, everyone, when he's walking in the corridor, everyone he's looking to this gentleman. Oh, that's, because of, maybe his, maybe so many characters, his influence people, his way of talking, his influence people. That's, the leadership as. Now, the leadership, and this is, we want to actually to define between leadership and management. So leadership, as we say, everyone say, but let's make it in what you mentioned. Leadership is doing the right thing. Management is doing things right. In other words, leadership is doing the right things in deciding the best course of action to take. And someone say, the difference between manager. Now, when we say manager, actually, you cannot find a person or, for example, a person in cafeteria. He's a manager without a position. He's supposed to have a manager. He's supposed to have a position to be a manager. However, if you want to be a successful manager, you need to have the characteristics of the leadership. That's what we want to be. So managers here, they are organized to create a human system that can implement the plans as precisely and efficiently, efficiently as possible. So management is about coping with complexity. Leadership, by contrast, is about coping with change. Now, all of these things, when we talk about it, when we talk about leadership, we say the leadership is about, learning how to cope and with the rapid change. And we are going to tackle what does it mean change. The change, actually, just a brief and a quick way, the definitions of change is moving from one place to another, or moving from one situation to the better one. That's continuous improvement. That's the definitions of change. Now, how does this distinction to play out? That's something we need to be, aware about it. And that's the difference between leadership and management. So management is about coping with complexity. It's to bring order and predictability to a situation, but that's no longer enough to succeed. Companies must be able to adapt to change. So if you want to be successful, you need to, you need to have you need to be innovative. So nobody can copy you. So you need to be, a continuous improvement. And here we can give a fantastic example for example, Dell, if you remember, we have remember the computers, Dell and other, for example, one of the old computer, we call it IBM, if you remember this. Now, if you remember, Dell, they are continuously thinking and, for continuous improvement. So they look for what the customer they want. For example, they look, for example, the customer they don't want heavy computer. They want a small one. They want, for example, smart one. They want the fastest one. So every time they are thinking in this way. Now, IBM, they produce a large, they have a production mass of computers. They will not be able to produce more and more computers. That's why we need to have a rapid change and see what the customer, and that's depend on what's the customer request. And here, as a leader, you need to think about your people. Actually, honestly, nobody, when I ask leaders, what's your role? What's your job as a leader when you are in a healthcare system? What's your job? What's your priority? Let's say, what's your priority in in your hospital? If you are, for example, working in a healthcare system, what's your priority? الآن أنت قائد، ما هي أولوياتك كقائد في داخل مستشفى أو في داخل عيادة؟ شو هي أولوياتك؟ Can you mention to me what's your priority as a leader in a healthcare system? What's your priority? I want to hear from you guys. As a leader, what is your priority in healthcare system? Staff. Suha, she said, Anne-Marie. One person, he said, patient safety, provide equality. Actually, honestly, so many people I asked, they will not be able to answer me about this question. As a leader, what is your priority in healthcare system? Yeah, so many say, some people they say patient safety, respect patient, Tariq, good outcome, good practice in patient safety to improve the work, a quality care for patient through good leadership, which is lead to the good teamwork between the team and of physicians. Mm? Teamwork. Okay, to be a good example from the group. Yeah, quality of life. Wow, achieve the goals. Okay. Actually, yeah, you are right. But actually, and honestly, when I ask this question for so many people in healthcare, especially the leadership, when I ask, what is your priority as a leader, they are mentioned to me patient, and actually wrong. This is wrong answer. As a leader, your priority is the staff. To care for your staff. If you care for your staff, they are going to produce the best. This is your priority. To have a staff satisfaction, this is your priority. So you care for people who care for people with this is the patient. So again, as the leader, your top priority is to care for people, and that's the importance of essence of leadership. Again, that's Mariam. Okay, thank you very much, Mariam. Yeah, this is what I want you from where, from now and then to think in this way. As a leader, we want to think in this way. Fine. Now we will have a small, just a small video about the versus between leadership and management. What is the difference? This is just a small video for kind of information. See? Just a second. So let's see the video here. Yeah, share.
Hi, welcome to Education Leaves. In this video, I am going to discuss leadership versus management. Let's start the video. While many of you may think that manager is also a leader, so these two terms mean the same, but actually not. Maybe there is some overlap between the work that managers and leaders do, but these two terms have different meaning, and they should not be used interchangeably. Both imply a unique set of skills, characteristics, and functions that share a few similarities. They also show some strong differences in some circumstances. For example, some people lead without a managerial role, while some managers do not practice leadership. We can define leadership as a process of social influence, which maximizes the efforts of others towards achieving a goal or a specific target. It is the art of motivating a group of people. On the other hand, management is the art of work done through people, with the satisfaction of the public, employer and the employees. I have discussed management in another video, check that video in the description. Leaders set the goal, managers follow it. When it comes to setting and executing a company's vision and aims, leaders and managers have different roles. Most leaders have a clear vision of the position of their organizations in the future. However, they are not the only ones who are responsible for fulfilling the vision. Here, managers play a significant role. Leaders transfer the company's mission, goal, and vision to the entire organization, and managers are responsible for keeping employees aligned with the core company's goals and values. Leaders think ideas, managers think of execution. Leaders are looking for improvement in the organization, while managers emphasize rationality and control. A leader always comes up with new ideas and delivers that to a person with a forward-thinking mindset. Basically, leaders look for answers to why and what, while managers look for answers to when and how. Therefore, the manager's primary responsibility to complete their tasks and reach their goals based on the leader's vision. Managers' job to make their employees feel free so that they can share their voice. Leaders are concerned with ideas relating more high level, while managers relate to people according to the role they play in a decision-making process. Leaders' attention to what should be done, to achieve the best results, and a manager's attention to how to get done. Leaders form the culture, managers support it. When it comes to the organizational culture, the difference between management and leadership is that managers lead their employees to live up to the culture, which was shaped by the leaders. Inspiring leaders have the power to influence employees' behaviors, and communicate the organizational culture company-wide. So, driving employees to live by the company's core value and culture is impossible without the collaboration between management and leadership. Leaders inspire people, managers push them to their success. Leaders have the great power to inspire people, and managers are responsible for their success and positive experience. When leaders are unable to inspire their employees, managers take the responsibility to help their people succeed. If an employee works effectively within his workplace, it is the result of honesty, open and transparent communication between the leader, manager and employees. Leaders peek into the future, managers take action in the present. Leaders are basically more future-focused while managers are more focused on the present moment. Therefore, the manager's most important target is to come through organizational goals by utilizing procedures around budgeting, staffing and organizational structuring, while leaders tend to think ahead and capitalize on future prospects. In a business, it is important to have both great managers and leaders. The organization needs a good leader to achieve its mission, and a good manager to ensure the things are getting done to reach the company's vision. If you want to read in details or download
So we understand what the difference between leadership and management. Now we're proceeding for what this is. It's already what they mentioned right now. So I'm going to just to pass through all of that things because it's already mentioned in the presentation. As you mentioned now, the leader is a person who influences a group of people toward the achievement of the goal. And we mentioned the word is the most important is influence people. So leaders by its meaning is one who goes first and leads by example. So what others are motivated to follow him. And we mentioned leader is, because he's influenced people because his way of speech, because his way of talking, maybe because, his way of walking in the corridor, he admire people. So he got, everyone gets, he admire people. So, all of these things is about leadership. Now, we're talking about the characteristics of the leadership. The first characteristic to be consistent. What does it mean to be consistent? Anyone have an idea what does it mean? Consistent? Actually, now one thing that I love just to share with you, it's one of the characteristics of the leadership is to be consistent. Actually, it's not a good idea to say, the secretary say sometimes, we will tell you today he is not in a good mood. Please, nobody interrupt him. Now, it's fine, but don't forget, we are a human. We understand, but there is sometimes we call it emotional intelligence. Emotional intelligence. If I have family problem or any problem, I should not forget I'm leading 1,000 or 500 staff. This is not a problem. That's I'm not in a good mood. That's okay. But you need to, if you are not feeling good, don't come to the duty in that day. That's why sometimes when you go to the secretary, what they mention or what they recommend, don't enter in his room. He is not in a good mood. So one of the characteristics of the good leadership, he is consistent. And that's actually what we need to have, especially when we are talking about, leadership. So that's one of the adaptation, skills I can really recommend. If going to work is going to affect, access people to you and managing the organization, especially people they deal with you. This is don't come to the duty in that day. This is one of the adaptation skills that you can manage by phone or do whatever you want, but don't come to the duty if will affect your people to access to your office. Leaders, they are consistent. They have a good emotional intelligence, which difficult, not an easy to get. That's emotion. So sometimes people they get emotionally involved. So don't forget, in the organization managing, we are managing business. Do you think hospital is business? Yes, it's very much business. Government is a business house, of course, but the government is paying. Yeah, there's a third party who is paying. It's not a free, correct? So that's one of the things that we need to consider. Understand and managing heterogeneity and diversity. This is one of the characteristics of the leadership. So the leadership, you look to the competency or diversity first. Yeah, diversity. You have people from different backgrounds, different places, different countries, different culture, different religion. You're dealing with a consultant. You deal with housekeeping staff. The housekeeping staff should know the contact time for disinfectant in the surfaces is important to be according to the guideline. Why? Because this will create resistance of bacteria. And doctors, they should understand that they should use the antibiotic appropriate to that test of culture, because this will create resistance of bacteria. And both of them, they can contribute to multi-drug resistance organization in the hospital. But you need the infection control speaks the language that they can understand. And here I'm not talking about English and Arabic. I'm talking about the competency of the housekeeper and the doctors and so on. When I say I understand your opinion, I understand mean it's a good to use. I understand your point of view when you say that your people organize, but it's not necessarily or they are not necessarily they agree with you. Okay, I hear you very well. Doesn't mean I follow you. Okay, doesn't mean that I follow you, or doesn't mean that I agree with you. I need to be open, and communicate easily in different level. It's very important to talk to the people in the language they understand, and not talking in English and Arabic. On the other hand, this is something is very critical. Now it's open to constructive opinion. I know some people they misunderstand it between when talk about the heterogeneity and competency and open to be open. Some leaders when we say let's do it, let's try to do that. So some people when you open when you just suggest an idea, they will ask let's do it. This is one of the leadership characteristics. Communicate easily at all levels. This is one of the things that we need to understand, that they are communicate easily in all levels. Understand the concept of equity and consistently advocate it. Now, this is a critical. If you want to be respected in your position, deal with everyone in equal way. By equal, that's in Allah yansur al-hakim al-adil law kana kafiran, correct? Allah will support who are fair. Deal with everyone in equal way. Listen to everyone. Same, even injustice in Islam has to look in both parties. Number of look here and here should be the same when it comes to the judgment and so on. So leading through serving. The leader will involve in the field. Somebody said facilitator to the team, protect the team, help the team, serve the team, sometimes bring food to the team. Yeah, it's really, yes, you can see, how much we spend time at work every day, how much we spend, awake at home. So this is, we spend, almost at work too much. So to be very sensitive to the talented of people. Now, we have people, they are very strong. They are very, very strong, and they are well known in the field. And we need to respect that. doctors in the hospital. Sometimes we doesn't know that they knows, doctor. That doesn't mean that they know everything. In the hospital, of course, not the complexity of such hospital. You need to look for a broad picture, and that's in the next slide. We need to look in the broad, picture of the hospital, not only to the specific in one department. For example, nursing. Sometimes person come to you talking about something, but you look by big picture. He's a spoken person. They're very diplomatic. The leader, he listen carefully, not hearing, active listening. He be strong to tell the people you should listen to him. Tells why. It's not, what we call it, a storyteller. They call them storyteller that tell why more than anything else. Understand and speaks for cooperative value system, and that's what we are going to talk in the next slide. Actually, I would love just to highlight about value. Value means that you give it more weight, more important. If someone touch these value, we will be in trouble. And actually, what happened in a healthcare system, sometimes people they pass it through and they have a list of values which is listed in the wall, and they start laughing because doesn't reflect the reality. And I totally recommend, and this, I'm totally recommend, don't copy and paste from internet. Once you have value, you need to train your people about these values. It's not about to copy and paste from internet, as I mentioned. What you need to do is first you come up with one value. What, for example, respect. What does it mean? Ask your people, what does it mean, respect? Does respect mean when you before entering the patient room you should knock the door? Does respect mean you should say hi or good morning or good evening? Does respect mean that that you need to take a permission from patient before you do anything? So we need to define. It's not about to copy and paste it from internet. And I have seen some in some hospital that I visited, the doctors they are shouting in nursing staff. And if you look to their values, number one is respect. Although the hospital director, he signed the list of values, and number one is respect. So again, we need walk the talk. If that's when somebody he touched the values, he need to be trouble. He need to be in trouble with the hospital director, with the medical director, with the operation director, and so on. This is something we need to give it more weight and more important. Adaptive participative management. So we have a different leadership style, and we will talk about them. Participating leadership style is not a democratic. It's not to sell your idea, but to follow the most appropriate idea by bringing the appropriate reference and appropriate evidence. People that don't come to the meeting with the three, judgment opinion. They come to the meeting for open discussion, and the leader, he is a facilitator. He will help people to provide them with all resources, and then all together they reach to the decision. Because autocratic leadership style depends on voting. Our autocratic leadership style, our democratic leadership style, sorry, is depend on voting. Sometimes people voting, so but they don't know anything, and sometimes people they vote because the leader he vote by this type of action. So it's a good strategy for a leader, not necessarily to tell his opinion in the beginning. Just hear from your people, then you see what they are going to say, then you can decide about what you want, okay? Now, one of the things that I would love just to mention for you about leadership competency. And actually, before we talk about, the things that we mentioned, there are so many important things or so many important competency about leadership. And now DCI, Sebahi, they start mentioning this in their standard. They have a chapter in leadership and DCI also. So now it becomes an evidence base. It's not anymore trial and error, just to try. There's a process to do budgeting. There's a process to do recruitment. There's an evidence base about coaching. There's an evidence base about performance management. Sometimes we spend 15 years or 30 years to study medicine and specialization. How much we spend to be a CEO or to be nursing director or to be medical director and so on. So it's important to have a qualified individual to lead the organization. Actually, I use this example. I don't mean, of course, any one of you here in the Zoom. Now, most of our hospitals lead by director who is doctor. Now, my question, which is good actually, but my question, if I ask, which is better, to be a businessman or a doctor to run the hospital? Which better to run the hospital, to be a businessman or a doctor? Anyone have an idea? Somebody say doctor, somebody say businessman, رجل أعمال, okay. Both. Doctor, of course. Okay, doctor. So if I asked you why you mentioned doctor and why you mentioned businessman, anyone who mentioned businessman or doctor, please mention to me why. Why you answer businessman? I mentioned both. So, okay, why both? Okay, Hiba. Okay. Okay. Now, okay, thank you very much, everyone. Thank you for your participation. The priority, okay, businessman only seeks for quantify. Doctors knows how to provide. Yeah, okay, you know how to provide care for patients. The one who should run a hospital should be either businessman or doctor who are having qualification for hospital management. Oh, Nader, thank you very much. Nader Abdat, yeah, Nader. Thank you very much, Nader Prophet, Nader Branch. Okay, excellent. Both, but it's depend on the training and management and leadership. Ahsanti, ya Mariam. Thank you very much. Leadership is not specialty for that. Okay. Okay, guys. Actually, I will tell you the best one to run the hospital is a leader who are qualified in leadership, who are qualified in leadership. Now he is a doctor by training. Maybe it's a plus. It's a good. But if you tell me fantastic surgeon to run the hospital, we lose the surgery and we lose the hospital. It's not enough. So you need to have a competency. Now, American hospital in Abu Dhabi was run long time by non-doctors for a long time. It's not necessarily is a good model, but always successful hospitals are run by good leaders who are qualified, who are what? Qualified. Not necessarily to have academic or certificate, but you need to have a competency. Wow. Now, what kind of competency that we are talking about? We talk about, for example, patient safety competency, quality management competency, leadership competency, and so on. Because the hospital is about what? It's about people, individual, money, process, patient, and outcome. If you have individual who can run all of this business, then you have a qualified one. So that's you know, things need to be done in perfect manner. Now, let me just take you one step forward. Now, this is if you have people, money, and outcome process, then you have a service. So you run the business. And one of the most important competency for any leader, it's how to serve people. How to serve people. Now, a new concept, we call it leading by serving. Leading by serving means empowering individual by giving them the lowest amount of resources required to enable them to do the job. This is the minimum thing that I can do as a leader. Okay, this is what we call it, you know, how to serve people. Yeah, and this is a new concept actually, leading by by service. Serving means empowering individual by giving them the lowest amount of resources required to enable them to do their job. This is the minimum thing that I can do as a leader. Now, another one is to have high caliber individual in the critical position. What is the best gift, actually? What is the best gift a CEO can do for any hospital? I mentioned CEO, this is the Chief Executive Officer, which is we call it Hospital Director. Now, what is the best gift a CEO can do for any hospital? Actually, I have seen this in so many literature. Now, what is the best gift a CEO can give for any hospital? Anyone have an idea? What is the best gift a CEO can do for any hospital? I ask one question. What is the best gift a CEO can do for any hospital? شو أكبر هدية ممكن يقدمها مدير مستشفى للمستشفى؟ What is the, what is the best gift a CEO can do for any hospital? Best quality, enough qualified staff. أحسنت 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 أحمد you're a great. بعض القادة يستخدم اسلوب التهديد بالذات التقييم الوظيفي يستخدمه مع الموظف وهذا اسلوب خاطئ. طبعا of course I totally agree with you. تحسين تقديم الخدمات, improve, improve the services, employ a leader in each department. Advanced technology, choose a good staff. Thank you very much, Omar, thank you. Now, actually, you are right. Thank you very much. I really appreciate all your answer here. Actually, one of the best gifts that a leader can give for any organization is to have a qualified, high caliber individual in the right and a critical position. This is what really you need to do. This is, you need to have the right people in the right position, like, like a human resources, like, nursing director, like a quality director, like finance director, and so on. If you have the right people, then you go and relax home after working hour. You can play golf after working hour and relax because you have the right people who run the business. And sometimes we pay a huge amount of salaries for certain position, and we underestimate some certain position in the hospital, and it is a critical. You know what kind of, of positions in the hospital, they are very critical, and most of hospitals, they are underestimated, is the supply chain management. Anyone knows about this position? Supply chain management. We call it material director, if you know material. They are very critical individual for the hospital. So we need to look for the leadership competency is having somebody with the evidence base. And, you remember the cycle is to have someone with the evidence base, and that's affect, and this cycle will affect individual under that person. I hope it's clear. So now, we talk about, the code of leadership. This is what we call it, the habits. They are, the concept of leadership have a certain habits, and I'm going to talk about it. One very important habit, it's focus on people. Focus on people, not on controlling and inspection. Again, ربنا بيحكي لست عليهم بمسيطر. Okay, it's about caring. You remember, we need to care for our people. As a leader, your job is to care for your people. Leader A and leader B. Anyone hear about that? Leader A and leader B theory, leader A and leader B. Anyone hear about this theory? نعم أحسنت. No, yes. Okay. No one, hear about leader A and leader B theory? No. Okay. Thank you very much. Okay, leader A is a person who take care of people, and this person believes, the theory says, if you take care of your people, they will produce the best. Now, the leadership B, he said, I'm not caring about my people. I need outcome. I need this much production at the end of every month. We call them sales target. How many we make, that's it. This is what is good for me. That we call it leadership type B. Okay. Now it's depend on your approach and your evidence and your evidence that you follow. However, in healthcare, we need to care about people. It's not about it's not about you cannot quantify. In other words, you cannot quantify healthcare services. You cannot count it in a way, for example, how much patient you treated every day. What is important for us, how safe patient care. So this is something is very is very important. Another one we know the concept. Do you know the concept leading by serving? So leading by serving is a critical. So we talk about it. Now we emphasize on communication and listening. Communication and listening is very critical. The good leader who listens. You agree with me? How much, just think about it. How much psychological harmful when you talk to somebody who is important and he is playing in his mobile phone in an important meeting. Think about, you know, a meeting with a CEO and you came from somewhere else to meet that CEO, and maybe you buy, a new, suit, and you have a new perfume and everything, okay? And this gentleman, and when you start, and when they ask you to come in that CEO and you start talking with him, he starts playing with his phone. This is non-verbal, influential, very powerful communication. So it's important to listen. The successful people have very strong listening skill. When we say listening, you know what is the difference between listening and hearing? Anyone knows what is the difference between listening and hearing? What does it mean? What's the difference between listening and hearing? What is the difference between listening and hearing as a leader? Yes, we are. Hearing means you listen carefully. Okay. Mhm. When you listen, you care. Okay. Okay. You use empathy. Listening is hearing carefully. Okay. Listening will be with a focus and serious interest, Reem. Okay. Fine, fine. Now, thank you very much, everyone. So, listening actually not to get feedback or reply, okay, in your comment. Listening means analyzing what you say and maybe what you are really talking to me, making me understand more. Then no need to say, oh, I like those people who say, oh, I got it. Thank you very much. Somebody would want to ask a question, then I got it. There's so many people want to say things. Do you know about an added value talk? What value you add, we don't know. Especially when we talk about the efficiency in leadership. I like the leader who say politely, of course, in polite way, of course, and a new idea. Somebody repeated the same idea. Okay, we talk about that. Thank you very much. And a new idea. This has not to do with the respecting individual, but it's about how we can train our people to be efficient in the meeting. About what you say. Sometimes we spend 2 hours discussing something that can cover in 30 minutes. And then the other part, when the leader is listen, is a role model for everyone, where everyone goes to listen. So leader, here the last one, leader is looking for change better. The right definition of change is not just to reorganize the situation. Change is moving from one status to the better one. Otherwise, we call that deteriorating. Change means continuous improvement. I hope it's clear for everyone. Now, we have what we call it collaborative leadership competency. Now, one of these competencies, leader is a multiplier. Multiplier, what does it mean? He looked to the competency, working in competency of individual. If someone is promoted or get another position, my job as the leader to attract. That's why leader is a talent, is a talent magnet. Is a talent magnet mean he attract who are a good talent. If you are a leader, employer by choice, like people, people like to work with you. You are a good leader. So you can attract who is a good talent. How it will happen? By caring for individuals. Open-minded. I like the people, oh, let's do it. Liberators mean like open for any idea. Let's see, let's try. Challenger, he's a challenger. Debate maker, who accept the reality that I am not perfect. I always say I learn. We are learning from each other. Okay. Investor, of course, he look to the future and he is target and time. Okay. This is what we call it, the investor. Now, leadership focus in a new era. First, putting the patient first. Now we said about putting the patient first. How we are putting as a leader the patient first. Anyone have an idea? Putting the patient first. How we are as a leader, we are putting the patient first. Anyone have an idea? Again, I'm telling you now, I visited so many hospitals. When we say about putting patient first, it's by action, not by values written in the wall. I always look to the hospital. Sometimes they write patient-centered care, patient-focused care, patient number one. Stand up for patient, do for patient, patient. That's talk. So we need walk the talk. You see, if you have an extra budget, if you have an extra money in your budget, where you will spend your money? It's depends. If you are really walk the talk and you believe in patient safety, you spend the money number one in the patient. I allow me to say this example. If I want to evaluate hospital, how much patient-centered care, I go to the toilet of patient room. If it is nice, good smell, clean all the time, safe, then I go to the CEO office. The CEO office toilet there. This is one of the criteria because we can talk forever, correct? I visited so many hospitals that toilet for patients not really appropriate in terms of size and safety. This is just an example. As we said, always the excellence in the details. Anyone knows Burj Al Arab? Do you know Burj Al Arab, ya Jamaat al-Khair? Burj Al Arab. Did you visit this place? Anyone visit this place? Anyone can tell us, his experience? Yeah. This is the only, maybe, this is the only, one of the best hotel, by the way. This is the only 7-star hotel. One time, there is a quality manager from Malaysia, and we were talking about the concept going to the details of patient request. Now, one of the options, the one who book online, what type of water do you need to have in your shower? What type of a greeting style do you want to have when you enter the hotel? You know this? Yeah, they go to the details. And maybe somebody will say for me, it's about money. No, not always. I know this hospital is very, or this hotel is very expensive. I understand. But it's about leadership. It's about leadership, and that's something, to be honest, is very critical. So again, putting the patient first, it's not by talk. We need walk the talk. If you have an extra money in your budget, are you going to change the furnitures of your doctors, of your leaders offices, or you are going, for example, to have a good waiting area in emergency department? So you are a leader. So you need, once you are putting the patient first, we need walk the talk. Okay. Now promoting innovation. Promoting innovation. We are now with a lot of competition. We need to focus on innovation or an innovative item that makes our organization to jump. And this is where the competitors, they cannot copy. Now, managing the talent is a critical. How much we promote, who are really smart. I know some leaders, if they know somebody smart, they put them down because they will be a threat. And that's very serious. And when you ask the person to talk about he will give fantastic lecture. This is where we need to add. So again, it's about complete package. Now let's have just 5 minutes a break, and then we'll come back. Okay, 5 minutes a break, then we'll come back. So 5 minutes a break, then we'll continue, inshallah. Thank you very much. Okay, so let's continue. Now, one of the things of the leadership they need to promote is to promote care for the bedside care. Now, the bedside transforming care at the bedside. What does it mean? Is having a sponsorship in each unit where that the sponsor is a head of department. He lead the patient, for example, safety program in that unit, or the NACE manager is responsible about patient safety, not the quality department. It makes a difference. How this will happen? By do assessment, do action plan, and provide resources and implement it. If we talk about quality in the office, this doesn't work. The most important tool, if is the training and knowledge. So transform care at the bedside. Now, another thing which is very important is the leadership safety round. And maybe you hear about it, and this is one of the standards. It comes in most of the accreditation. They're asking to have a leadership round. What does it mean, leadership round? Anyone have an idea if you are doing that in your organization or not? So actually, the purpose of this leadership round is to enable to talk with the staff, without any barriers. About safety concern. It's not about promotion or uniform or other things. So this is the leadership around. So it's about to have a purpose and talk about safety, or to talk with the staff without any barriers, and about patient safety concern. It's not about promotion or uniform. The question would be like, where do you think we may harm the patient? Where you think we have, for example, an issue? So maybe there's a resources, maybe a communication issue, maybe an equipment, maybe doctor's behavior, maybe privacy, maybe confidentiality, and so on. Patient safety briefing. We have a briefing and debriefing. So briefing, sometimes in the hospital, they do something we call it a briefing. A briefing. So after the unit is finished, they are talking about for example, changing in triage process, or this is one of the things that we need to able to do that, especially in the units or department doctors round. They are having a briefing before they start. After finishing the round. So Joran says the planning is more than half of success for any project. If you don't plan, he says you plan to fail, correct? So before you do anything, you need to do what we call it a briefing. We have debriefing. So after you finish an activity, you do debriefing. So you need to know what is the difference between a briefing and debriefing. So briefing, before you start the activity, you start planning what you are going to do, what you are going to say, what you are going to assess, and who will be responsible and accountable for. Debriefing, after finishing the activity, we're going to say where we went wrong. Just tell us, what is the opportunity for improvement? Where's the opportunity for improvement? So process redesign to improve the reliability and patient safety. This is one of the things that we need to focus on, to remove the unnecessary steps that is not added value to the staff or to the patient. That's something is very important. Senior leader adopt work units and resource management. Resource management here, we're talking about something we call it return of investment. If you want to buy a system related, for example, to medication, and there is a lot of literature support that this system will reduce, for example, error related to the medication. Now, related to the medication reconciliation, for example. If you have this error, this will cost the hospital, for example, $1 million. And the machine costs, for example, 250,000. So, how we are going to calculate the return of investment? So 1 million dividing by 250,000, and you get 4. This is the return of investment. Okay, you got it? Accountability as part of the system improvement, and so on. Now, I do not see this part. Develop a dashboard for monitoring. This is one of the things that we need to have. Now, yeah. Second day, we'll talk about all of these things, but I'm going to just to mention it to you as a vision and mission. Vision means where you want to be. This is as a leader, you need to have for your organization vision. So what's your vision? So where do you want to be after 5 years or 10 years from now? Mission, this is the vehicle that will carry you there, okay? This is the vehicle. So for example, my vision to go to the US, okay, this is vision. So what's my mission? So what's the vehicle that will carry me there? Okay, it's by plane or what? You need to define how you are going there. This is example for the leadership. Leadership commitment. Hospital leaders absolutely have to have a strong commitment to patient safety. Otherwise, it will never happen, and that's true. So people they are coming to the hospital. They are coming to the hospital, walking sometimes, okay, and sometimes they leave with the with the injury. Just a second. Yeah, sorry. So leadership commitment. If the leadership is not committed to the patient safety, is not going to happen because, as we said, the leader. They shape the culture. They have the resources. They have the power. And if you don't believe in it, it will be stuck somewhere. So we need to work in these things in order to and believe in it in order to be done. Okay, fine. So this is something about the patient safety program. This is one not to tackle it, and this is about the goals and mission, and that I will tackle it as I mentioned to you in the second day. So I'm not just to mention it in very fast. Okay, engagement. So we have something we call it leadership, leadership to promote patient safety. What is unique about the healthcare is value-based. What does it mean value-based? Anyone have an idea what does it mean value-based? Okay, مبادئ, قيم, values. Okay, fine. We'll say no voice. I asked one question, guys. I'm just answering. Okay. I said the leadership, they need to focus on value based. What does it mean in value based? Okay. Okay. So I hit where I kind of make a difference. Think about it. When you work every day 8 hours, just analyze what we do every day and see how much you add value to the outcome. You see, sometimes people who are really busy, they are very busy, and they get tired at the end of the day. But what would they have done? What is the outcome? That's why we say for people, thank you. You are hard worker, but unfortunately, you are not. You're not able to to produce. You are not able to achieve the outcome. That's why it's very critical to know where to head, and that's required actually qualification. That's why if you ask a nurse to insert a cannula, she will do. She is trained. She know the anatomy. What is the steps, the process? Give somebody the needle, and he is engineer. He's PhD in engineering. He cannot do that. He's not trained. So management is the same. You need really to know how to deal with people, how to help them, how to support them to do the right thing. That's why now, for example, GCI, they started mention evidence-based management. What works in science, in clinical practice, evidence management. Evidence-based management says don't punish. If you punish, you destroy the morale in your organization. Still, some people, they say, I want to make a lesson to everyone. I want to make him a lesson to everyone in the organization. Again, we say evidence-based science, okay? So value-based means that that we give it more important, more weight. I hit where I kind of make a difference. This is what does it mean? Okay. Sorry. Just a second, guys. Just I want to highlight from that. Okay. The perfect storm. So the perfect storm in any hospital, we have high technology, we have patients, we have genius doctors, we have a need around us, we have a scarcity of resources, we have the limit amount of money that we need to run. So not anyone can run such a complex system. Running a hospital, it's not an easy thing. There is a book for one author, I remember, who run a Disneyland for 10 years. And then after that, who was a CEO of Disneyland, then a CEO for one hospital after 2 years. By the way, he wrote the book. Now, the book is available. And the title of the book, 9.5 Lessons that I learned from running the hospital after Disneyland. This gentleman, he said, there was so many differences. One of the most differences, he said, doctors, nurses, pharmacists don't do like a Disneyland stuff. When they deal with their customer, when the Disneyland customer come in, all worker there, they live with them, the experience. They dance with them. They swim with them. They play with them. Everybody happy. This is, actually he's describing. He's not saying this is right or wrong, but he said in the hospital where I work, doctors, nurses, pharmacists, I see they are dealing with their patient like production line. Diagnosis, he's a cash buyer patient. This is the logbook. This is the number of surgery. This is interesting case. Bring the student. He's in the corner. He's a pneumonia case. He said this is really very hard, and it's really a dry approach when you deal with the human. He said this is the most significant, important differences, and he don't mean to be sympathized with a patient like a girl who did not come to the work after baby died. This is wrong. He didn't, she didn't train how to handle emotion, not to be involved, but to understand the feeling, to understand when there is a patient in pain, to understand the psychological of waiting in emergency department. This is what we need to understand, okay? Now, that's something we need to figure it out. Okay, now we have so many leadership strategies. One of these strategies sets a quality as priority. What does it mean? Now, this is important. Which is important? Parking for patient or furniture for the leadership? Which is important? Medication management system or changing the uniform of nursing staff? There were so many things where we spend a lot of money, but for patients, we say, excuse me, I don't care. What I care, I don't want to wait too much to see the doctor. I want to find a parking before roaming around the hospital 15 minutes or 30 minutes. I want the bathroom in my room to be clean and to be okay. It's important, but so many times we spend money. For us, important, but remember, our values say patient-centered care. But for patients, it's not important. We are not matching for what we say to prioritize, correct? Now, leadership should supposed to be focused in urgency. in urgency when it comes to the patients. We cannot delay patient safety, engage, the governance. Example, this is something is really is very important. So the governance and the board, you see the board, the board the board means support, we have, for example, the CEO and Minister of Health involving the governance by using appropriate tool to work in a critical and governance. I should be, a board means support patient to be now a lot of literature, so says about the board supposed to be from different. We have from different positions. They have and what we call them. I forget the title of that. It's not come to my mind. I'm sorry for that. Maybe it will come later on. Let's proceed later on. Okay. We have the quality and safety in every agenda. Motorola CEO, he says, I attend the quality annual agenda. I don't attend the financial agenda. They said how the company will survive if it is not good financially. He said, if the quality is good, everything will be good. And that's true. Yeah, that's really true. Now, leadership competency, we talk about, this is one of the competencies, patient safety of the leadership he needs to have. One of the leadership of competency to have, management. They understand how to, to manage people, okay? This is one of the competency of leadership they need to have. Now, sorry for that. Yeah, this is one of the leadership competency that they need to have. Okay. Now, make healthcare safer by reducing harm caused by delivery of care. Now we have so many things that we need to have it. I want to just to I quit one thing. One of my colleagues here remind me. Adopt patient safety as a vision. You need to have it as a guide, as a part of your vision and mission. And this is a good guide because the vision will always guide where to go. Now, this is something we need to understand it from the beginning. Now, I love this. If you go to the hospital and you see there is a vision and mission or values to be innovative, to be customer happiness, to reach the sky, a lot of things, correct? For me, doesn't make any sense. As far as you have patient harm, there was one hospital, I remember, their vision, feel at home. Feel at home. This is, one guy, he went to that hospital. He found his medical record is lost. So he said, I'm not sure if I feel at home. So we need to be careful when we write our mission and vision, okay? This is one of the things that you need to be, careful about it. Fine. Another thing, the healthcare priorities as per national quality strategies in the US make the healthcare system safer by reducing harm caused in delivery care. How we can make our healthcare safer? Again, from the beginning, we mentioned that we need to care for our people. If you care for your people, the staff, doctors, nurses, if you care for them, they will care for your patients. So make care, care safer by reducing harm, and that's something we need to design our system in a way that our patient will not be harmed. How we can do that? Again, we can do that by develop our policies and procedures that we have it in the hospital by following the evidence base. So if we have that, if we design it in a way that the patient will not travel from one area to another, we need to design our system. Again, one time I visit one hospital. If we want, for example, to have an appointment, like appointment and to have a cath lab, if you have a cath lab appointment, the patient, he need to travel from one place to another until he gets the procedure done. So, how it comes, first, he need to go for registration. After to go to registration, you need to go for what we call them, the insurance company to approve your request. And then they need to wait for 30 minutes. Then you need to go for finance to get the approval about the, the amount of money, if it is approved or not. Then you need to go again for the, catheterization unit to know what type of catheter the doctor that he will use in order to approve, to approve the procedure for you. So again, we need to design it in a way, in one hospital, for example, Bangrand Hospital in Thailand, if you have an appointment, you go directly to the cath lab. So no need to do all of these unnecessary process, we call them. Ensuring that each person and family member are engaged as a partner in their care. And how we can engage them now, it becomes now one of the requirements in some accreditations that they are asking to engage the patient and family in their management. How you are going to do that? By when the planning care. Once you plan the care for the patient need to be involved. He need to sign the consent, for example. This is how we can a patient and family be engaged in their care. You need to tell the patient your case is not with the emergency or with the general surgery. Your case with the orthopedic surgery. Your case is not with the internal medicine. Your case with the surgery, for example, and so on. Promote effective communication and coordination of care. Our healthcare as a leader, we need to think in this way, that we need to promote communication, effective communication. As you know, most of our errors happens because of communication. And if you go to some accreditation, for example, like Sabahi, they mention about handoff and communication, maybe in 20 standards, talking about communication. That's because they want to give it more weight, they want to give it more important, and also if you go to the, for example, the most sentinel event. Sentinel mean unexpected event, unexpected lethal or permanent loss, and required to do investigation. 70% of our error lead to the death. 70% of sentinel event related to the communication. Again, we need to have a system in place so to promote communication, where we have we can then a coordination of care. So after patients finish, so we need to coordinate the care, the home care or follow-up care, and so on. Promote the most effective prevention and treatment practices for the leading cause of mortality, and starting with the cardiovascular diseases. Now, the most 40% of the population, especially in the Gulf region, they have cardiovascular diseases. So start with that. Start with the prevention. Now, our healthcare system is not a curable system. So we need to think in a prevention, not in treatment practices. Working with the communities to promote wide use of the best practices to enable health living, and making quality care more affordable for individual and family, and employer and governments for developing and spreading a new healthcare delivery system. Now, if you see the highlight of initiative, we have so many initiatives in healthcare. We have making care safer by reducing harm caused by delivery of care. They have partnership for patients. Now, one of the top priorities, they are involving patients. For example, the patient who are having experienced such harm, they are roaming around the world and talking about their experience. And how they can prevent, and this as well, and they can share their experience in order to prevent error in the future. Ensure that each person and family consumer assessment of healthcare provider. This is one of the things that they use in order to have patient satisfaction. Promoting effective communication and coordination of care. This is an example, and the website is talking about how we can promote and effective communication and coordination of care. Promoting the most effective prevention and treatment practices. This is one of the highlight initiatives. They call it Million Hearts. You can see the website. They are talking about the cardiovascular diseases and how they can prevent it, and so on. Now, setting the aim. Now, one of the 6 from IHI 6 activities for board to focus on setting aim. So setting aim, set a specific aim to reduce harm. This is year, and now getting data and hearing stories. If you want your top management, your leadership to release resources, tell them story. Tell them story. If you want them to feel the pain, let them feel, hear a story and show them the data. Establish and monitor system level measure, changing the environment, policies, and culture. Now we talk about culture. By the way, what does it mean? Culture. Culture. What does it mean? Anyone here? Anyone have an idea about the culture? What does it mean? باقي 5 دقائق على الصلاة. Okay, 5 minutes. Then we go for prayer time. That's fine. Okay, 5 minutes. What does it mean? What does it mean? What does it mean? Culture. Okay. Okay, thank you very much, everyone. Culture, actually, it's how we do things here. It's how we do things here. Culture, when you enter the hospital, so what is the values? What is the beliefs? What is the values and beliefs in that hospital? We have hospital. Sorry. So we have hospital A and hospital B. They have doctors, nurses. They have policies, procedures. They have, KPI, key performance indicators, and they have CPGs, the clinical practice guideline. They have a plan. They have a scope of service. So what is really different is the culture. So the component is not an issue. The most important thing is the culture. And the most critical person in terms of culture is the CEO. The CEO, he's a role model. He's a change agent. He's promoting the values in the hospital. He is a role model for everyone. So again, we need to have, the culture, what we call it, it's how we do things here. And that's depend on and the values and beliefs that we are adopted of. We have something we call a dominant culture. It's what I would see when I enter the hospital. This is the dominant culture. Okay. Now establish executive learning, starting with the board, and establish executive accountability. Accountability is start with involving the leadership. We have something we call it involvement and commitment. You know what is the difference between commitment and involvement? Involvement means that you involve them in the workshop, give them tasks, let them give lecture about quality and safety or anything. So let them involve in the activity that you do. But commitment, I am committed. Patient safety. Once you have something about safety, I'm going to sign. I'm committed person. We say, okay, commitment. This is things that we already mentioned about it. So this is this is how to engage the governance. So we'll talk about now. I will stop here for the prayer time. I know people that just remind me about prayer time. So we need to go for the prayer 5 minutes. Then we come back. Okay. Okay, Dr. Saleh. So we are going for 7 minutes. Let's say. Is it okay? 7 minutes for the prayer. By the way, we have a break at 7:15. So we go for 7 minutes because at 7:15 we are going to stop, okay? For 15 minutes. Thank you very much, everyone. Thank you. 7 minutes for prayer time. Okay, so let's continue. Okay, the leadership engagement is very crucial, and I would love just to share with you one story for the Minister of Health. What will happen to the board if it's the board? In 2012, actually, there was one hospital they called Calcutta in India. One hospital, they get fired. They lost 90 patients in a few hours. All nurses and doctors, they were not trained for fire and safety program, except the three nurses. They came from another city away from Calcutta. They call it Kerala. So the nurses, they were trained. They tried to do the measurement of safety evacuation and all of that. They are unfortunately get stuck and they died with patients. So what will happen to the governance in that hospital? Of course, they will go to the jail. In Australia, if the hospital they don't achieve national accreditation for any cycle, they have to resign immediately. So this is the CEO and directors. Again, I'm not a person who say accreditation guarantee patient safety. This is only a tool. That's why involvement of governance is very important. Think about if you lose a baby or infant abduction in one hospital, it will be a disaster. It will be a tragedy. It's not about doctors, nurses, and that's the package. No, it's about the governance. It's about the leadership in that hospital. So it's about the governance. Does the governance identify the risk area and put the measurements in place to have a safe to have people safe or not? That's something we need to important. So again, engagement is very crucial. You see, you have to focus in the governance board because they have important thing to focus about patient safety. The main rule for any governance to oversee the mission and vision and provide resources and to get involved and empowerment the people. If you want to evaluate any government, sorry, I look to their agenda. What they discuss when they meet. They discuss anything about staffing, patient safety, how much we want to expand, or sometimes the governors they are busy by shifting one stuff to the another. This is operation side, okay? So again, it's about whole system together, recruiting and involving the front line. This is something is very important to gather information, to set priorities, to follow through the front line as a part of the solution. Again, we have more a crucial part. If you want to know where to focus, where to hit, you need to involve the front line. I'm going to share with you one story. They call it one of the morale story for one big factory in the United States. This factory was the production rate for this factory was $1 million per month. So unfortunately, the machine there was shut down. So the owner of this factory, he asked for engineering, for consultant to come and fix this machine. But unfortunately, they failed to fix it. And one in staff who was working there, he said, "I can fix this machine, but how much you will charge me?" He says, "I will give you whatever you want." He said, "I need $1 million." He said, "Okay, fine, go ahead." So in that time, he was having a small bag. He opened this bag and he take a small hammer and he went to the machine and he hit the machine and the machine started working. Then the owner of this factory, he asked this employee, "I need itemized bill." He said, "Okay, fine. The cost of the hammer is $1, but to know where to focus, where to hit is the rest of money." So again, the front line is a part of any solution once you are involving them. The idea behind that story that we have so many things. We are struggling. Sometimes leaders, they are sitting in their offices. They want to solve one issue, but go Gamba. Go Gamba. Gamba means go to the work area or where the workplace where the problem is and ask people about the problem. So people, they spend 80% of their time, they want to solve the problem in their offices. No, you're supposed to go and see by your eyes and ask the frontline staff, what is the operation? How you are doing this? How you are doing that? Tell me about how we can improve the services. They know. They are aware more than you. So everyone is responsible for sustaining the game. And this is, again, is part of the game, is a part, sorry, is the part of the, success. So we need to let everybody accountable and responsible. One time I remember that we were preparing for accreditation, re-accreditation. So one doctor, he passed in my office and he said, "Good luck for tomorrow, accreditation." Again, it's not my responsibility; it's everyone's responsibility. Okay, so we need to feel that. So this is again, it's part of the success. Follow up. Follow up is very crucial as a leader. If you want to be successful, you need to have a good system and follow up things once it's designed, once it's planned. So you have a plan to do, one good area or waiting area in emergency department. So responsible person is engineering X. So you need to follow up. There's a deadline. So you need to follow up this action if it is done, not done, and feed you back. What is the obstacles or what things not making this thing done? So this is for the successful leaders. Again, quality and safety in every agenda. As a leader, make it okay to talk about concern. Talk about concern, and here I want to highlight this. As we said, the Motorola CEO says, "I attend the quality annual agenda. I don't attend the financial agenda." He said, "How the company will survive if it is not good financially?" He said, "If the quality is good, everything will be good," and that's true. So we need people to share with us their concern. You need to present data. You need to have, as a leader, you need to be, as a competency for the leadership, you need to have a decision. To have a decision, you need to take a decision based on data and analysis. So it's not about yes, we need to have a meeting. You need to have a planned meeting with a arranged agenda and have a story. If you want leadership to release resources, tell them a story. If you want them to feel the pain, tell them a story and present for them data. Close the cycle. Example, close the cycle. And I have seen that in so many organizations that they have so many action, so many things need to be done. We have input and we have a process and we have output. So you need to evaluate the cycle. So, is it okay? Is it in the right track? Is it we are in the right track or not? So, for example, let's say talk about, for example, event or OVR happen in the hospital. So OVR sometimes they close the cycle by giving feedback to the reporter by "Thank you very much for your reporting." Now, this is not a closing cycle. If you want to close the cycle, you need to have action and feedback the reporter what kind of action that you did. So in order to encourage me next time to report things, highlight action taken. This is something is very important. Measures the effectiveness. Again, I'm telling you now, so many, for example, Sentinel event happen. As we mentioned, Sentinel event is unexpected, lead to the death or permanent loss, and required to do RCA, root cause analysis. Sometimes what happens, we do RCA, we do root cause analysis, and we guess that we reach to the contaminated part, we reach to the root cause, and then we did an action, and then we ask for the status of the action, if it is done or not done. So everybody says done, 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 done. After 2 months, the same problem or same event happened. That means we are talking about something else. So we need to measure of the effectiveness of our action, if it is effective or not. How we are going to do that? By having an indicator, KPI, key performance indicator, to measure the effectiveness of our action. I hope it's it's clear. We mentioned about transforming care at the bedside. We give one example about that the leadership who will be, or the leader or the manager of that department, he will have the leading the topic about safety and equality in the units. Maybe, for example, having one goal, for example, identify patient correctly. So everyone in the hospital, they need to define patient correctly. So we need by two patient identifiers. So everyone, they are going to apply this. So this is one of the things that we are adopting in order to transforming care at the bedside. Leadership safety round supposed to be structured. Structured mean already organized who will be in the round. For example, CEO, CMO, nursing director. We have so many people. They need to be in the round. So this round is conducted in daily or weekly or monthly basis. We need to define that, and who's supposed to be the leader, the CEO, for example, or CMO or nursing director. Once we define, so it will be structured, and again, the question will be covered all the clinical area at the bedside, and asking the staff about their concern, about anything will be compromised, the patient safety, and so on. This is something is very important. It's a communication tool. We listen to the staff, to listen to their concern, and so on. Now, take a look for the leadership rounding in Cleveland Clinic. Let me show you the leadership round. Just a second, so I can share you with you.
I love Leadership Rounding because it really gives me an opportunity to connect with our patients and their families.
As I've grown as a leader, this has been a really effective way to kind of keep a pulse on what really is happening at the front line.
It's something that you can't get if you're sitting in your office. You need to go out and actually speak with the people.
When you show up, you're greeted by our team who will actually present you with a card about where you're going to be rounding and who you're going to be rounding with. And on the back side of that card is a number of suggested questions. You enter the auditorium. We have a set agenda that we run through every time.
I want to welcome you to Executive Leadership Rounds.
Welcome to our November Executive Leader Rounds.
So our agenda will have a brief pre-round presentation.
And then we'll break to round.
And we are going to head out and be back in this room to debrief.
We structure the leadership rounds typically that there's 3 people rounding. You have a specific contact that's connected on the floor, so you won't just be walking around. We now bring iPads, so you can simply type in what you're hearing, and all of that is collated in real time. I hope people see leadership rounding as an opportunity to dig deeper into the character of the people that serve our patients. So we need to be able to dig deeper in our questions. And although some of those can be simple yes and no questions, obviously open-ended questions that really invite the person to tell you a story about their experience, that can be very powerful.
Do you have all the support that you need?
What do you find is your biggest challenge in taking care of patients here?
Anything else you want to cover, or questions you had, or things that leadership could help you with?
It gives us a chance to voice out any concerns or any improvement that we need to run our flow really well.
You know that you're noticed, and you know that the leaders are truly invested in putting our patients first and truly invested in the caregiver at the bedside.
We want to be able to see patients on that area and really get their feedback.
Part of it really is how you're asking the questions. And what I mean by that is, if you go into a patient's room and you say, how's your experience going? And they say, oh, it's great, thanks. We're not getting any meaningful information about that. You need to be prepared to go deeper.
Do you have a few minutes to talk with us?
Yes.
Is there anything that you can think of that we could do to improve your stay here?
I understand exactly what you're saying, and you know, this is the type of feedback that we need to hear.
The other thing I often ask about specifically is, would you mind naming one person that really had an impact during your stay? Give me the name of one person who touched your life here.
It makes me feel good to know they, you know, I'm a patient, but at least they're thinking about me.
It shows me that they do actually care.
The top man coming and talking to you, that was wonderful.
I typically debrief by starting off with the specific questions we asked, and then invariably it starts to loosen into just stories people heard.
He talked about how difficult it was when they felt like they had no direction, but how gratifying it is that they feel like they're now on the right path.
Stories that are generated through these interactions are really, really powerful, and they reinforce why we do what we do every day.
To be out there and see how the programs that we're learning about in the board meetings are really taking hold with the caregivers, and to see the patients, well, it was very uplifting.
To be a part of what Cleveland Clinic is about and to help for the change, and to be invited as a patient now is most important to me.
It gives me an idea of what the employees are thinking, what their challenges are.
It allows me to connect to where the work is, so that I know when I'm sitting around the table, I am advocating for the right things.
I hope that leaders walk out feeling like they have an impact, that the moments they create, the words they say, matter. And if that's what we do, I'll feel that we did something successful.
Yeah. Now, one thing that I want you to know about one of the leadership science, it says, if you design the process in your hospital to meet the convenience of nursing staff and doctors, you know, the patient safety at risk. Now, we design things in the hospital only to make the convenient, the patient safety. However, if it works well with the doctors and nurses, that's good and well. But we don't do it to make the doctors happy or nurses happy. Now, example, sometimes what happens, the doctors and nurses, sometimes they will say, bring patient to the clinic, but it's better for the patient to be seen in the unit. Go and see the patient, correct? Now, again, if you can see here in the video, we have so many things here. It's talking about the leadership, impact their, and the staff and patients, and how they are really, in touch, and they want to know the concern, or anything could compromise their work. And this is one of the things of the round that will help, of course. Now, return of investment, we explained that. That will help for any leader if you want to know a return of investment. For any projects, you need to calculate it. If you want to convince the top management about your project, calculate the return of investment. Come up with the return of investment. You know, how come much of money that it will come to me once I bring this a new machine? Once I have, for example, a lifting machine, or once have, for example, the medication management conciliation system. If I have this system, how much it will cost me? 1 million. Okay. What kind of things that will save money for me? Okay. We have, errors in the hospital, or medication error. We have, for example, cost our hospital 250,000. Fine. So 1 million divided in 250,000, it will come 4. This is the 4 return of investment. So we are not convincing management right now in this moment or in this era. Oh, I have a new idea. We need to adapt it. No, we need to prioritize it, to prioritize our project based on return of investment. I hope it's clear, everyone. Now, promoting just culture. This is one of the things that the leader, they need to be able to promote it. What does it mean, just culture? Anyone have an idea about that? What does it mean, just culture? No blaming, just it's as a from the word of justice. Thank you very much. Just culture, we're not going to blame you, we're not going to punish you. However, the person who is involved in the event, he's going to be accountable, to be responsible, to tell us where we fail and how we can improve next time. This is the just culture. Just culture means no more to hand the narcotic, tell you improve yourself, or we are going to remove some certain privileges from you till you are attending some certain classes or to improve yourself. Okay, this is just culture. Just culture, it's a balance. Okay, we're not going to blame you or punish you. However, you are accountable, responsible to tell us where we fail and how we can improve next time. This is what does it mean, just culture. As a leader, we need to promote it. Now, why I ask, why one of the responsibility of leadership is to promote just culture? Why do you think if this is important? Why do you think this is important? Promoting trust to reduce, okay, fine. Okay, in other words, let me ask you one question in different way. If I say, for example, if you punish people, what kind of message that you deliver when you punish people? What is the message that you deliver when you punish people? Okay. Influence. Okay. Fine. Actually, once you punish, the message that you deliver, don't let me know next time. Yeah, the message that you deliver, don't let me know next time. This is the message. When you punish people, the message that you deliver, don't let me know next time. And again, as we said, leadership science says don't punish. If you punish, you destroy the morale in your hospital, correct? That's we need to understand it very well. Structure the process to investigate error and near misses. Leaders' involvement and investigation and quality improvement process. This is something is very important that we need to know. Once we involve leaders, we keep them accountable. If we want something to be done, we need involvement of the leadership. So again, we have investigation and we have action. We need someone to support us in order to, to implement these action, a quality improvement process. So once we need as the concept, it's now we change from errors is a potential area for improvement. We don't say we have a problem and for example, a problem and theater, or theater. We say it is an area, it's a potential area for improvement. Now, we need to prioritize patient safety improvement as best structured criteria. We have a criteria, and we mention how it will look like. Now, dashboard. Why the leadership, they need to be aware about or to have a dashboard for monitoring the data. Now, dashboard is a snapshot about what's going on in the organization. It gives you an overview about the status, about the flow, in the healthcare system. Example, we have sometimes indirect way financial issues. For example, number of patients visits. Okay, this is number of patient visits. This is money, correct? Number of operations. This is money. Number of, for example, let's say of procedure done. This is money. We have something related to human resources data about staffing, about the vacancy, about the turnover data, and so on. This is all these things give you a snapshot about the status in your organization. Okay, this is something is very important to any leader he needs to have in the organization. Now, stakeholders, what does it mean? Stakeholders who are impacted by our decisions. Stakeholders who are impacted by our decisions. Again, this is something is very critical, very important. Once you want to have something done, once you want to make for example, you want to design a process, you need to bring the stakeholders. Who is impacted by this? You want, for example, to make a policy about medication administration. Who is impacted? Who is the stakeholder? When we say stakeholders who are impacted, we talk about pharmacy, we talk about doctors, we talk about nurses. They are impacted by this policy. So I cannot make a policy with a pharmacy only. I need to involve the physician. I need to involve the nursing when I design, when I create the policy. This is the stakeholders. Stakeholders mean who are impacted by our decision. So need to be involved. And one time, there's one article they mentioned about talking about stakeholders. Why medical staff resist equality? They mentioned, this is the title of the article. Why medical staff resist equality? And actually, the medical staff, they resist equality because the quality professional, they don't know quality. Correct? Sometimes what happens, they sit in their offices and they create policies without involving, for example, nursing or physicians. A second day, when they see the policy, they will resist. They don't want, because they are not involved. So again, it's very important and very crucial that you are involving the stakeholders once in the process. So embedding the accountability, setting the expectation. This is about the involvement. We talk about all of these things, so not repeating that about the stakeholders. This is one time they are talking about having system in place for stakeholders. I'm talking about there's one guy from US. He asked his friend, could you recommend for me one good restaurant in chicken restaurant? He said, yes, this is X restaurant, go and tell me what's your experience next day. He said, okay, fine. This gentleman, he went to the restaurant, he found really a fantastic, looking of restaurant. He entered the restaurant, he said, what do you want? He said, I want chicken. He said, what kind of chicken do you want? We have a chicken with the skin or without skin. He said, no, I need chicken without skin. He said, you can find your order in the next floor, okay? So he went to the next floor. He said, what do you want? He said, I want chicken without a skin. He said, okay, do you want chicken with a bone or without bone? He said, I need chicken with boneless, without skin. He said, your order, you can find it in the next floor. He went there, he said, okay, I want chicken boneless, without skin. He said, do you want chicken cutting to the pieces or you want whole chicken? He said, I need chicken cutting to the pieces. He said, okay, you find your order the next floor. He went there, the people, they welcoming him, and he said, what do you want? He said, I need chicken without skin, cutting to the pieces, boneless. He said, your order is, or your request is out of order. Now, the next day he met his friend. He said, oh, tell me about your experience. Is it a great restaurant? He said, actually, I did not find what I'm looking for. Okay, the restaurant, maybe the design of the restaurant, the things is, it's fine, is everything there, but does not meeting my expectation, does not meet my request. So again, once we design our system, we want our system to meet the customer or to meet, the customer, let's say, needs. So we don't, design our process in order just to say we are wow and designing, but it's not meeting the staff. So again, it's about involving every single one. We want to meet the customer satisfaction, which is patient. We have a staff satisfaction and so on. So it's about having system in a place. So engaging of physician, this is also very crucial. Again, this is just recently, they are asking to involving physician. And guess what? Once they involve physician in the process, once they design the process in healthcare system, they reduce the error from 70% to 20%, just involving the physician and put them involved and accountable. You can see here, the engagement of the doctors about an IHI physician involvement model. They are talking about, adapting in style. Maybe this picture is not clear, but you can understand from that once they involve the physician, how that's affected the care, improve the patient outcome, they reduce the unwasted time. They have so many things, and I'm doing now project with so many doctors that we are involving them. And honestly speaking, once we involving them, we have a great outcome. That's why it's very important to involving them. And you can see here from engagement, a process. So the organization with highly engaged employee have what we call it fewer patient safety incidents, and that's what we are looking for. Look for the absenteeism, look to the high turnover organization, and so on. You can see that it's have high impact. Okay, guys, we need to stop here. 7:22. So we are going. We will come at we have 15 minutes from now. So 15 means 35, 37 from now. Okay, 7:37. So 7:37, we are going to continue our course, inshallah. Thank you very much, everyone. So we'll have a 15-minute break. Do you have any question? You can write it in the chat box so I can, in between, answer your question. Thank you very much. يا اخوان احنا الان في بريك. البريك هو 15 minutes، فخلصنا 7:22 راح نرجع 37 ان شاء الله. I hope it's clear for everyone. Okay, so let's talk about change. Now, change management. Now, the agenda that we are talking about, we'll talk about individual and organization shape. We'll talk about the organization shape quarter steps and personal type needed to manage change. And we have a case study and 6 key preparing to conduct change. Before we start, we are going, because people they are asking so many questions when we are going to finish. We're supposed to finish at 11 o'clock. So 11 p.m. So we're going to finish, inshallah. So I hope that if we can finish before that, I will do my best. I know today is Friday, so we'll start to finish 10:30. 10:30. Just give me 1 minute. Just 1 minute, then I'll come back. Just a second. جماعة الخير أنا بتأسف صار عندي بس technical issue. I just try to fix it. I'm really sorry for that. Okay, so let's start. Change. So what does it mean change, by the way? Now we'll start with change. What does it mean change? Change. What does it mean change? Naif, he said, yeah, تغيير. Improvement. Move from thing to another. From one state to another. Modify. إحداث فرق. Okay. If you remember, when we say about change, moving from one situation to the better one, make something different. So, if you change from one area to another, if it is not better one, it would not, it not means that it's change. Okay, Rawia? So we need to understand it's change from one place to another. or to the better one. Yes, change to the better one. This is what does it mean, change? Yeah, a continuous improvement. This is change. So change means letting go to the old and encouraging something new to develop. Something will become something else. We don't end up with where we started. The end result is very different or completely different from what we started with. This is the change. Change means that we transfer from one state to the better one, or we call it continuous improvement. This is the change. Okay. So we need to understand. Now, I would love just to, ask you one question. Why do people resist change? Why do you think people, they resist change? لا ما يتأثر حضورك يا طارق بقى. استاذ طارق ما بتاثر بالخروج، يعني انت لما تسجل بسجل كم بالضبط كم ساعه انت حضرت يعني. بس انا بس حاب اجاوب للناس اللي بتفوت بتطلع، يعني عم بسجل هو قديش اورز انت لما تدخل في يعني amount of hours بيطلع لنا بزوم قديش انت حضرت. فذاتس فاين، ذاتس اوكي. Yeah, okay. هسا we said why do people resist change? And I have seen people, they answer this question. They mention that they are in comfort zone. They are afraid they will need to change their routine. Okay, Nora, that's great. الخوف من النتائج العكسية. عبد الرحمن, thank you. Why do you think people, they resist change? They are afraid. Yeah, that's good. It's about habits. It's fear of change. It's about of adaptation. Oh, okay, fine. Why do you think people resist change? Why do people resist change? I need more answer. Fear of unknown. They are in a comfort zone. They got out from the comfort zone. It's a quality, Abdurrahman. Abdulhamid Asif. Hajar, she said, go out from the, they are going out from the comfort zone. Yeah, right. Yeah, most of your answer is correct, actually. Trying, trying something else. Okay. Fear of failure. Nada, thank you very much. They're afraid from failure. I think some like work under shadow. Okay. Loss of control. That's great. Okay, you are really totally correct. Why do people resist equality? From your experience, they are afraid of change. They are afraid. Number one, they are afraid. You are right. They are afraid of unknown. We don't know what there is in the future. They don't know what's the expectation. Nobody explained to them. That's why they are afraid from the outcome. They are afraid to fail, as you mentioned. You're right. I totally agree with you. All your answer is totally correct. I totally agree with you. They are in comfort zone. So once the people, they want to change and they want to do something, they are they used to do everyday paperwork, and now they're having what we call it electronic system. This is big change, and they don't know how it will be easier or will be difficult. So that's why nobody explained to them. So it's unknown, it's vague. ما في صوت. يا شباب سامعين صوت يا شباب؟ There's a voice? Yes. Okay, thank you very much. Thank you very much. Thank you. So why do people resist change? We understand now. Now the question is, what factors encourage them to embrace change? This is the second question. What factors encourage them to embrace change? In order to make change, what things need to be done? Encouragement. Fatima, she said encouragement. Thank you, Fatima. Okay, involving stakeholders. Thank you very much, Iman. More benefits. Give them a guideline. Briefing about change. Thank you very much. Thank you. What else? Training. Thank you. Thank you very much, Fatima. Yeah, what else? The deep training, Nayef, involving them, understanding the benefits, awareness, again, experience. أنا التحفيز الإيجابي. Fine, great. Now, short and long-term plans, transparency from the leadership. Okay, training and support, evidence-based. Okay. No, I'm telling you now. Let me just, having, tell me one story. I don't know if I can allow. If you can raise your hands, and tell me story that you did one change in your place where you work, and how you manage resist change. Change. What kind of factors that you encourage to embrace change? If you can, raise your hands and share your story with us, you are more welcome. Just raise your hands. Anyone would love just to share his hand, just write in the in the chat box, so can allow you to speak. I don't know if it's not working. No one? Okay. Actually, okay, thank you very much, everyone. Actually, the factors that encourage them to embrace change first, people, they want to know what you want to change and why this change why you are going for this change. Is it important? Is it necessary? The change that you are talking about? So we need to explain to them. We need to involve them. Involve them in the process. Again, people, we said they are resist change because they are not involved. So we need to involve them in the change. For example, let me give you one story about moving from paper to paperless. Okay, when we decide to go for paperless, so people, they start talking why we are going to the system, why we are going from electronic system. Is it because they are afraid they are going to spend much time and writing and doing things in the system. Now, once we explain to them what kind of system is and how this is the system they are going to gather information from the first time you entered in the system. So no need to repeat and no need to have duplication of things in the system. So people, they start understand. Another thing, it's more clear. So people, our handwriting, sometimes some people cannot understand their handwriting. Maybe they didn't know the spelling. Now the system can correct you about the wording things that you are going to do it, okay, or to write it or typing it. So this is one of the things that it will help us in order to read your note or read your assessment in a good manner or in a good way. This will help us, yes, of course. So how this is, this happened once we give them an overview, once we give them what we are planning to do, what is the benefit, what is the disadvantages of this change. So we give them the advantage and disadvantage and why we are going there. And number two, that's the number two of which can embrace change is involvement, as you mentioned. Get them involved, ask them about their input. What do you think if we put this form in the system? Do you think it's difficult? So how how it will how do you want this form to be look like in the system? Do you want this to be permanent? Do you want this field to be dropless, or do you want this to be in this kind of this way? So people, they start once we ask you ask their opinion, they ask their suggestion, they become involved. they become enthusiastic about the outcome. So the most critical part and the impairs change is involvement. So once you involve them, they are you will get that you are going to impair change. This is the most critical part of this of this. Now change happen either out of threat or out of opportunity. We need to see the necessity and either way. As we mentioned, we need to have the advantage and disadvantage. The change can happen gradually. Can I have 1 minute just to answer this? Just 1 minute, please. Change can happen gradually, incremental change, or rapidly or radically. There is also transition change from one stage to another. So we have phases, phase 1, phase 2, phase 3. We are not going totally paperless. We are going, for example, to start with 1 form or 2 form. Then we start for 10 form together. Then we start to the, to the 1 unit. Then we start to the next and next and next, okay? This is the way how we are going to change. The ultimate goal of change management is to engage employee, as you mentioned, everyone. So you mentioned, some of you, the answer engagement or involvement. That's something is very critical in any success, in any change that you are going to do. Changes their daily behavior and adopting new ways of doing their work. I remember when we started, accreditation in one center, they actually resist change. They don't accept it. They said we are not going to pass. Once we started explaining to them the advantages of this change and involving them and having the teams, the teams in preparation for accreditation, they start believing in it. They start to see the outcome. It's not about, accreditation. As I mentioned earlier, in the course, I'm not this kind of person says accreditation guarantee patient safety or guarantee anything. At least we change the behavior of people. They will start thinking in a good practices. Now the accreditation or standard, it's the minimum things for patient safety. It's not something that's guarantee having a good system. Change management is a planned approach to change, structured process of linear and predictive stages, task, or intervention completed in a specific time scale. A successful change initiative will also deliver value to the organization. This is the change. Now, people think about process has to be adapted in the company. Now, when we talk about change, like for example, change from paper to the paperless, or going from paper to the electronic system, when we're starting and involving the people, and we have a plan, we have the Gantt chart, and we have stages, we have the steps. The step number 1, we start to identify what kind of forms that we want to transfer them to the electronic system. For example, we start talking about which unit we're supposed to have piloting phase. Okay, are we going immediately to the active environment, or we are going to the, for example, to the what we call it, the trial environment? So we need to test. So before we're going live, we need to test this form. So people, they start understanding the process, how we are going to the paperless or to the electronic system. They start believing that this change is going to be happen. So once they understand it, now once they get, once they feel the advantages of this transition or this change, sir. Now, a problem during change. First, we mentioned about, employee resistance. Now, people, they are resist because you are not involving them. Why people resist? Because you are not involving them. Once you're involving them, explaining to them, you are going to avoid the employee resistance. So this is something that's very important. Inappropriate culture. The culture is not ready for change. Now, again, you don't have resources. You don't have enough staff that are burned out, and there is so many issues in the culture that it's not ready for change. So again, that's why we said we do assessment. This is the first stage in any change, that you are going to do assessment for the culture. Is it ready? Is it the infrastructure is ready? Is people they are willing to learn? Is they willing to change? This is something that we need to capture it once we are doing assessment or gap analysis, we call it. Lack of management agreement on strategy. Once there is no clear vision or clear dream, the change would not be done in the appropriate way. So we need to be vision there in order to be cascaded down. You will never ever see change without a clear strategy in the management that they are going to be cascaded down. Poor leadership, and that's something we mentioned again. We need to have leadership involvement, and we need qualified leadership who are leading the change. So this is need qualified leadership. I cannot accept any leader who are not qualified, because we are going to fail. So again, I'm telling you now, if you have the right leader in the right position, you are going to success in your change. Poor planning happened because we because we did not prepare, we did not involve the right people. Now again, once we involve the right people, we have the right the right people and of change. So I'm going to the paperless. Who is involved? I having so many organs, so many departments that are involving with me in my transition. We have IT, we have nursing, for example, we have doctors, we have, for example, patient relations. We have so many departments, they are involved. So we need to plan. So if you spend enough time in your planning, you will have a great outcome. Just imagine that you are planning to have, for example, your villa. If you spend enough time in your designing your villa, you will have a good outcome. So you ask your wife, for example, or your husband, what do you want? What kind of house do you want? Do you want 1 floor or third floor or 2 floors? Do you want boys' room, girls' room? So where you want to be? Where do you like do you want your kitchen to be open? So do you want to have, for example, a garden? All of these things. So if we spend enough time, and we say the excellency is in the details. So that's why we need to think in the details. And again, I want to highlight one thing here in the planning phase. A planning phase can be really successful once you have something we call it FMEA. Once we adopt something we call it, one of the quality approach, we call it FMEA, FEMA, failure mode effect analysis. This is one of the proactive approach. So you are asking yourself, this is an imagination, what's going wrong? What could go wrong in this process? If I have this wrong, what I need to do? So you are going, or you are just, you are imagine that we are going to do this kind of change. But okay, during this change, what thing could happen during the change? Is the process is in place? Do we have policies for change? Do we have, for example, policies for infection control because I'm going to have a change or I need to have a renovation? Do we have safety measures is there? But what could go wrong if we start this change? So if you ask yourself in this way, now, not only you need all the teams, all the stakeholders who are involved, they need to ask such questions in order you have a good planning. Your planning will be executed in a good way, then you will have a great outcome. Poor communication. This is one of the things. Okay, poor planning. One of the poor communication. Again, communication is very important. We need to have input, then a process, then outcome. So we have a communications. You need to have delivered in a good way. So if we have, for example, planning, we want, for example, someone to do for us, for example, to create a policy. Let's say, who will be responsible to make a policy? We don't want to say this department, they are going to do this policy. No, we want specific person with a specific deadline. So, and then we are, because this is the way of how to be, or how to deliver a good communication skills. So people, they are going to make a changes happen once we deliver the information for the right person. Insufficient skills to facilitate change. So again, who is the person who will facilitate change? I need somebody with authority, with the power, and we are going to tackle that later on. What does it mean that, you know, empower? So we need somebody with power, with the power, who are supporting us with the leadership, with the position, who are a manager or director or a CEO, who supporting our decision, who supporting the change in order to make it done. So we need someone with authority in order to make this change done. Incomplete follow-up again and again and again. Why this something is very crucial. Now we give tasks, we give deadline, but there's no follow-up. Now, how you are going to make things done without follow-up? You need always to have a system in a place for follow-up. You give tasks, you give deadline, so you need to see that, you know, you need to see if it is done in a way or not, in a good way or not. So you need or you know, continuous follow-up in order to have a change. That's all this a problem that could happen during the change. Now we have change at the individual level, we have an organization level, and we have you know, change as a culture. Now we have individual level, and this is the condition, or the necessary condition could happen in the individual level. First, we call it dissatisfaction. Now, dissatisfaction must be high to get people to embrace change. Once dissatisfaction has been created, then the energy must be channeled. So we need to, you know, people now, once they get the, you know, sorry for that. Yeah, vision and goals is about organization know where it's going. The vision and reflected in a new attitude and behavior and values that will be expected of people, as well as a sense of what the organization will become. The vision must be communicated. Now we have a vision, and everybody works to the vision. So everybody starts, you know, executed in a way it's done. As I mentioned to you, once I have this vision in the leadership and the management, then they are going to be cascaded down. So everyone work toward the vision or work to achieve the vision. Then it's going to be done. So again, I have seen that in so many organizations, they are you know, now in the vision 2030, all the, you know, organization around the country, they are you know working how to achieve the vision 2030. So everyone, because it comes from the government to the companies and institutions, and then to the individual. Now, individual feel accountable, responsible to achieve the goals that have, you know, that has been created to the organization. A process centers to the fact of change is not evident, or was not an event. Rather, it is an ongoing effort that moves through phases, mobilize, move, and sustain. So, you know, the flight, or the you know, you know, what we call it, the airplane, they are in the ground, correct? Now in the ground, so the pilot or the plane will go up speed, then will go to the sky, like the growth stage, correct? Growth stage. So it's the growth stage where the pilot will go, where the plane will go to the sky, like in the ascending ascending way. This is, we call it a growth stage. Then the pilot will come up in the microphone and say, "We are now cruising." This is what we call it. We call it, maturity stage or sustainable stage. Now, sometime moving from one part to another, this is movement of change. Now we don't want in comfort zone or in the maturity state. We want to move to another state or another, we need to keep going always. More accreditation, more training, more certificate. This is a growth, okay? So we want, our organization to be in the part of the growth in order to comply with the change. So individual level, people resist effort to change is a part because of perceiving cost. Now, the expenses, the resources associated with the reskilling, learning a new routine and process. Now, sometimes some of the requirement of accreditation, people, they need to be, for example, certified in basic life support or advanced life support or trauma life support and so on. In order, so people, they are going to resist because it's costly, and the individual, he need to pay for that. Now, some hospitals, they said, no, what we are going to do, we are the one responsible to spend money for that. We are responsible for this change, so are going to be accountable, responsible for that. Political things, organization priority. What is the prioritization for the organization? Does this priority for organization to be accredited? So what is the reporting structure? What is the influence path? All of these things affect in the change. Social things, new work arrangement, loss of expertise status, and so on. And psychologically, we have emotional fear and fatigue. And that's what you mentioned in the individual level once the changes happen. So individual, they are afraid from expenses, from the political things, from the social things, from the psychological things, which is the fear and fatigue, and maybe I can add more about the overload. So all of these things could, affect the organization. Now the question is, how are we going to convince people about change? We want to show them, about the benefits that is going to happen in the individual level first, and then the organizational level. So, and the culture in the organization, and the reputation of the hospital, and the reputation of the employee in that hospital. All of these things will be affected. So once we have this explained in this way, we are going to achieve, things. Okay. Now, we have something we call a dissatisfaction with the status. We have reason to change. And we have something we call it V, a new vision or a model for organization where we are going. This is the P, where we are, the V. P, a process for change, how we will get there, the first steps, how. This is the, the change. Is it, more than, of the cost of change? It is bigger than of the cost of change, or what? So all of this is the formula of individual, how is, is looking for. He's looking for the reason of change. He's looking where we are going and how we will get there, for change. All of these things is in the individual level. You got it? Now, the change curve, this is the emotional stages. We have first in the change, we become in the shock phase. This is stage one, the shock, and then denial. When we started the paper, from paper to paperless, first the doctors, especially the old one, they become resistant for change. They are shocked of change. They are denial. They don't want that, and then they go to the stage two with this angry and depression, and the stage three, it becomes for acceptance. So all of these things, it comes by time. So how we can avoid the shock and denial stage, once we explain to them, once we give them the, explain to them where we are going and how we are going there. This is, it could, reduce the denial or the shock stage. Okay. Now, in the organizational level, this is, we have change in the organization level. We need to understand the process of change. We need to learn the tool for executing a successful change initiative, and also integrating individual adaptive initiative. Now we have, in the organizational level, as we said, we have accept of need for organizational change. Now, when there's a vision 2030, it comes from the government to the organization. Everyone, they need to accept it and adapt it to their organization. They need to understanding and acceptance of where the organization is heading. This is the vision. And understanding and acceptance of the plan for achieving the vision. This is the first step in any organization. This is the same equation. This is how we are, going for change. Now, this is the quarter steps for change. It counts for establish for sense of urgency. You start asking, or we start telling them why we are going for change. What is, the needs of change, and so on. People, they are sending to me in a private, they're asking for prayer. Okay, prayer, ya jama'a. طيب يا جماعة الخير. Okay, we are going for a prayer. Okay, just a second. Just let me just check the timetable first before we go into the prayer time. تمام يا جماعة. احنا الآن راح نروح ل prayer time from 2015 to 2030. تمام يا جماعة. طيب احنا الآن ربع ساعة يا جماعة لصلاة العشاء. ربع ساعة لصلاة العشاء يا جماعة الخير. فإن شاء الله بنكمل بعد إن شاء الله بعد ذلك إن شاء الله بإذن الله سبحانه وتعالى. يعني 15 minutes then we'll come back إن شاء الله. يعني 8:30 إن شاء الله. يا جماعة الخير احنا الآن في break الآن إن شاء الله. Just we are break right now for 15 minutes. Okay, just for prayer time. Just go and pray please, and then we'll come back inshallah and start. Thank you very much. Okay, so let's start. So let's continue our quarter steps for change. First of all, do you have any question until this moment? Any question about what we discussed earlier? Any question? You know, anyone have any question, please write in the chat box, please. Thank you very much. Okay, okay, great. Okay. No question. Thank you very much. Okay. Now, the quarter steps for change. Now, for kind of information, until this moment, this is one of the most famous and most popular one. It's quarter steps for change. This is one of the famous one used, and we have you know 8 steps for change. So the first one, establish sense of urgency. We need to let the people understand why this is important and why you know this is as a part of our you know of our priorities. Again, once we have it, it's our once the leadership, the top management feel the importance of change, they're not going to be cascaded down. So this is need guidance, need support, need you know need power, need decision in order to be cascaded down. Then we are going to have a vision. And so create a vision, communicate a vision, and then empowering others to act in the vision. We say the vision, it's how where you want to be, what you want to be after 5 or 6 years from now. Do you want to be the you know one of the most or to be number one in operate in for example in open heart surgery? You want to be as number one in the you know in the country in open heart surgery. So how you want to be? You know, you need to communicate that with your staff, and all of them. They need to feel this, and you need to understand where we want to be. Empowering others to act in the vision. So we need every single one, especially the line managers, to work in that and to act in the vision and how we are going to be that. So you need to have a good planning phase. So planning for and creating short-term wins. So quick wins, this is one of the things that I always recommend for anyone who join any organization. He needs to bring quick wins connected with the strategic planning, or what we call it with the vision that you have when the hospital what they have. So quick wins example, changing, for example, the you know the entrance of the employee. Changing the entrance of employee entrance. This is you know short-term wins, quick wins, so people they will feel the change. Consolidating improvement and producing still more change. This is something is very important to have continuous improvement. I have seen that in one hospital, they have smallpox for what we call it you know initiatives. They have something they call it Kaizen box. So people they have suggestion about improvement, about something as you know area for improvement. So and every month they choose one of these initiatives, and the one who win in this, they are going to what we call it to reward this person. So this is one of the way of how you are going to consolidate improvement and make it as part of the day-to-day living. So we want that. We want this culture of improvement. We want to consolidate that in all the organization. Everyone feel that. Everyone work toward the improvement. How you are going to do that? By creating the culture. Again, the culture is how we do things here. And the most critical person is the most important person in terms of culture is the CEO. So the CEO, he's a change agent. He's a role model. He is a decision maker. He is promoting the values. So I remember one CEO, he joined the hospital and he was a religious person. So, you know, in that time, we have a small masjid in that hospital, always empty. Once he joined the hospital, after 1 week, the masjid become full. So again, it's a role model. This and another time, I remember one CEO. He joined the hospital. He was he's just interesting about the sports. So after maybe 2 weeks, 3 weeks, all the organization they start talking in the same language, in the same. They're talking. Everyone talk about sports. So again, we want leader to be a role model. One CEO, he joined one hospital, and he was wearing a very nice suit. And once he entered the hospital, he noticed a piece of paper or piece of tissue beside the left. You know what he did, this gentleman? He removed it. Then everybody gets surprised because in that hospital, this is a responsibility and accountability of housekeeping, not a CEO job. Now, this situation will influence everyone either sooner or later, because if you see something wrong in your organization, you feel accountable, you feel responsible to contribute, either to fix it or to report it, correct? So what I mean by that, this is the culture. If you are a role model, if you are listening, then everybody goes to listen. So we want to create a culture in which we want to make a change. We have a clear vision. It's already communicated with the stakeholders, with the staff. We explain to them the benefits and what we are going to be, and then we have a plan. Plan is very important. We mentioned we need to spend enough time in planning phase because we don't want to fail. That's something in planning phase. It's something is very crucial. And remember, in a planning phase, we need to ask question about like this. For example, what could go wrong? What could go wrong in this phase, in this step? So if we do that, so what we are expecting to have, what we what could go wrong in this step. So people they go into giving 100 things could go wrong during a transition phase. So okay, if this is going to be done or this is going to happen, so how we can avoid it, how we can overcome these obstacles. So people are going to suggest some certain things that are going to be done if we to avoid for example the consequences. So by this way you are going to have a good and a great system. So we start with this instruction, with the vision, with the process. All of these things is a quarter steps for change. And remember that always, for any change that you are going to do. Okay, I hope it's clear. Now, this is a one example about change. So I'm going to establish sense of urgency. If you see number one, change is only successful if the whole organization really wants it. Now, if you want to make a change, the whole organization, they need to feel it, they need to like it, they need to enjoy it. If you are planning to make a change, then you need to make it, to make others want it. They want to, everyone, they need to feel it, as I mentioned. You can create an urgency around what you want to change and create the hype of what. This will make your idea well received when you start your initiative. How? Help others see the needs of change, spark that maybe you make, for example, what we call a start point. When we start initiative, we make an opening. So this is an opening phase or the opening start. So all top management leaders, the staff, they are coming that we are going for accreditation. So everyone, so we explain and things and how to be done. Identify the potential threats. How we are going to identify the potential threats? We said we ask what's going wrong. Discuss the opportunity. What opportunity could happen after we make this change? Ask a question and get people involved and start open and honest discussion and request support to strengthen the argument for change. This is something we got to do. Now, explain the urgency. This is Dr. Explain the urgency. Lasers remove the cancer much faster. Greater recovery rate, complication already have it, cost benefit analysis, positioning in the market, one of the first to have it, first and second mover advantage. Now, Dr. He's explaining the urgency for one thing, that he wants laser to remove the cancer. And he wants to prove that for all the organization. And he's explaining the urgency that the lasers remove the cancer much faster, greater recovery rate. Competitors already have it. Cost-benefit analysis, he got just to provide cost-benefit analysis with return of investment and positioning in the market. Once we get that, what's our position? What is our repetition in the region? One of the first to have it is the first and second mover advantage. This is all the things could you have. For a powerful guiding coalition, identify the key leader and stakeholders. Why? Because we want to make it happen. If you want to make it happen, you need to see who's the key leaders that you need to be involved and the stakeholders who will be impacted by our change. Then you need to assemble a group with enough power to lead the change. We need somebody with the power who can push the change. Convince these people that change is necessary and build a team of influential people. This is something is very important. Get visible support for the idea and build urgency and momentum around the need of change. Keep the momentum. This is something is very important, so people feel energetic, energized, and having all the the resources required in order to make things happen. Encourage these people to work as a team. Teamwork is the most critical part of any change, after involvement. Why the teamwork? Anyone, answer me why the teamwork is important for any change that we are going to do. Anyone answer me why the change is important? Why change is important? This is the question. Why change is important? Why do you think the teamwork, why do you think the teamwork is important in the change management? For more development, the will keep to be updated. Okay, fine. I need more. Okay, better outcome, different thought. Otherwise, change will not occur if there's no teamwork. Okay, Dana. Okay, it will be more effective if they work together. Hamad, Turkey. Time management. Okay, I need more. To hear other opinion. Fine. Okay. Do good work. Everyone needs a new idea to complete each other's things. Decrease the resistance to change. They will complete each other's. Okay, fine. You are right, all of you. Thank you very much. Now, do you agree with me? The team make a wise decision when they work together. So teamwork is one of the important part of it. If you have individuals who are not performing up to standard, teamwork will really get them involved. Then we diffuse the weaknesses. Then everybody will support each other. It's like the birds. The birds, when they fly, If any of the birds become tired, the birds become in the middle, and then those who are strong, they go to the front. You know this concept? If any of my team member needs any help, will support that person. This is, that yet we need to know that in the learning culture, those who know, that's why when we make our team, make sure from the structure of the team, don't put all fantastic and their performance together, and those who are not doing good job together. No, so you need to mix the team so they can learn from each others. That's great. So and all you mentioned, you don't have voice. يا جماعة الخير، في حدا عم بحكي صوتي مش ما في صوت؟ ياسر عم بحكي ما في صوت يا جماعة، ما في صوت يا جماعة. Do you have voice? Voice is good. Thank you very much, everyone. Thank you very much. Yasser, just check your Zoom. Maybe there's a problem in your account. So Dr. Am, he talked to the direct supervisor, director, talked to the other department that may be involved, and build your network. Explain the urgency and use your network within the hospital to build the correlation to support you. That's how to form the powerful of guide collation, we call them. Okay. Now create a vision or goal. So create a goal or direction for change, determine the values centered to change, and develop a short summary about capturing the goal. Make sure the collation understands, shares, and communications the goal, and develop strategy for achieving the goal. Now, when a change takes place, having a vision goal is a must. Because it's a direction. The vision makes everything clear to everyone. When you have a clear vision, your team members know why they are working on the change initiative, and the rest of staff know why your team is doing the change. Now, become one of the best oncology centers with the best recovery rate. You see, this is the goal. Using the latest technology and equipment. How you are going there? How you are going to be #1 in oncology center? By using the latest techniques and equipment. Oh my God, this is my vision. Okay. Communicate the vision and goal. What is, what's in it for me? Use every way possible to communicate the visions and strategy. You do marketing. You need to do marketing for your vision and goal. So make it frequently and powerfully. So it becomes, when it comes from the CEO to the staff, it becomes more powerful. Make sure as many people as possible understand and accept the vision and strategy. Deal with the concern and anxieties as quick as possible. So people, they are concerned, they are afraid from what's next. What will happen after that? So we need to explain to them and make this things is clear for them. So driving the goal is not just enough for you to implement the change. You need to communicate your goal across the company or across your organization. This communication should take place frequently and at important forms. So get the influential people, which is the leader that we talk about, and the hospital endorse your efforts. Use every chance to communicate your vision, and this could be a board meeting or just talking over the lunch. That's one of the things. It's how you are going to communicate your vision and goals in your organization. Empower others to act and generate short-term wins. Number 5, how to identify or empower others to act is to identify the change leaders. Who will be the change agent? So remove obstacles that prevent people from accepting the change. So people, they will say, oh, we don't have enough resources. We don't have enough computers. We don't have enough, for example, let's say we have understaffing. We don't have equipment. We don't have, so many things. So make sure that these obstacles is overcome before you start your change. Recognize and reward when change happens. This is very critical part. And once it's happened, you need to reward people for their initiatives. This is something is important, and encourage initiative and risk taking and ideas. No change take place without obstacles. Once you communicate your vision, you will only be able to get the support of the fraction of the staff. Always there are people who resist the change. So don't expect that if you introduce change, you will not find everyone will accept it. You will have some people, they don't accept your change. They don't accept the change. So it's already there. So sometimes there are process and procedure that resist this change too. Always watch out for obstacles and remove them as soon as they appear. This will increase the morale of your team as well as the rest of the staff. I remember when we start the accreditation, people they will say you will not get it, will not get to be accredited. We don't deserve to be accredited. So how you are going to communicate with those people? You know how we solve them. You need to understand that we involve them in the change in order to believe it. So once you involve them, they come, they start, they feel, they like it, they enjoy the process and everything. Then we become accredited. So as soon as this obstacle appear, you need as soon as possible to find an area how we are going to overcome these obstacles. So generate short-term wins. So plan for visible improvement, create short-term achievable target. So we want to have more computers, so make it done. Start with an inexpensive target with a little or no chance of failure. Celebrate the success. So every step you pass by or you already completed, you need to celebrate. Reward the people who meet the targets and show the improvement. This is all of this quick wins are the best way to keep the momentum. Going by quick wins, your team will have a great satisfaction and the company will immediately see the advantage of your change initiatives. So, once you're done, make celebration. Once every step you make it done, make a celebration with the involved people. Let them feel it. Let them like it. Let them enjoy it. So every now and then, reduce a quick wins for different stakeholders who get affected by the change process, but always remember to keep eye on the long-term goals as well. Now, consolidate and build on change. So this is number 7. Analyze what worked and what needs to improve. See the goals to keep things moving and improving. So continue to build momentum for further change. Hire and promote and develop employees to continue driving change. Refresh the process with the new projects. So this is all of these things is about, how to consolidate and build on change. Let the change mature. So many people initiative fail due to early declaration of victory. If you haven't implemented the change 100% by the time you declare the victory, people will be dissatisfied when they see the gaps. So therefore, they complete the change process 100% and let it be there for some time and let it have it to on time to get integrated to the people, lives, and organization process before you say it over. That's all of these things. It's how to consolidate and build on change. So, this is one of the things is very important and anchor the change into culture. So once it becomes the change, it becomes part of your culture. You need to talk about success. You need to market your success and, ask people to acknowledge it and embed the values and behavior from the change to the human resources process, hiring and training. So when you see there is a bad process or when there is a bad, let's say, behavior in your organization, go with the training. Again, don't forget, no blaming, no punishment. We are going to train people and to keep them accountable, responsible, about their action. Integrate the change, use mechanism to integrate the change into people's daily life and corporate culture. Having continuous monitoring mechanism in place in order to monitor whether every aspect of change, once we make change done, we need to have a system in place. How we are going to monitor the implementation. How we are going to monitor or to keep monitoring the implementation. One of my colleagues, he said, the most difficult part is the continuous monitoring or the continuous how to keep the momentum. This is the most difficult one. To keep the momentum, it's not an easy. So we need to have a system in a place how to keep the momentum, like monitoring. We have, continuous monitoring, continuous rounding. This is one of the things that we can do in order to keep the momentum. Yeah, this is the tackle and change urgency. How we can do that by get CO public support, get consultant support, walk the talk again, issue email notice, conduct a private interviews, provide internal skill building. This is all of these things, suggestion, how you tackle the change urgency, conduct pilot project. We mentioned all of these things. So I'm not going to tackle it and mention all of them. So this is the personal traits that need to manage change. Transformational change is achieved one person at a time. This is transformational change. So be brave and have the courage and the change. See the opportunity and mitigate the risk and reward them. So all of these things about why the things should work out and not of millions others why they shouldn't. This is all talk about of the change. Now, leadership skill needed. We need empowerment. We need empowering. We need to be aligned with the vision. We need people focused. We need organization. 11%. We need digital. We need Eagle. 8%. We need innovative. We need change management. 5%. We need a global perspective. We need culture focus. If you can see here, 20 and 17 and 15% and 11% talking about empowering. So we need empowerment. We need vision. We need people focused, involved. We need organization. This is the most important thing. So need for corporation, we need empowerment. We need from the top management. We need the input from everyone. So input from wider teams are needed. This top-down approach. So shift from top-down to the empowered, to the empowerment. This is what we call these things from the source of Manaza report. So what is the power? Anyone have an idea what is the power? What is the empowerment? Empowerment, what does that mean? Authority, the ability to make things, giving authorization. This is the empowerment. Okay. Make them have more responsibility, ability to change, also ability to change, empowerment. Okay, motivate, having control, allow self to make decision. Dana, ability to see the rules, or the ability to set the rules. Okay. What else? What does it mean, empowerment? Support the need, okay. Delegating power, take responsibility, giving authority and support. Yusuf, thank you, Yusuf. Take responsibility. أحسنتي Dana. Thank you very much, Dana. فاطمة, تحديد الأهداف وتحقيقها. Delegate authority, giving the ability to decide. Okay, giving ability to decide and take responsibility. We am the power to take decision by yourself, enabling. empowerment, ability to make choices. Okay, guys, thank you very much. If you can see here, power is the capacity to change other behavior, overcome resistance, and get people to do things they would not otherwise do. Now, in other words, power or empowerment, let's say, let's have a power in the words of empowerment. You know, empowerment mean is to enable your staff or to give your, you know, to enable your staff, or this is the minimum requirement. Now, the empowerment mean that give them the minimum requirement, you know, the minimum resources required to enable them to do the job. This is the minimum thing that I can do as a leader. Now, as we said, power is the capacity to change other behavior, capacity to change other behavior and overcome resistance and get people to do things they would not otherwise do. Providing withholding resources, as you mentioned, administering punishment and precise. Now, the only, you know, scenario that we punish people, this is once we have reckless behavior. You know, what does it mean, reckless behavior? Anyone have an idea what does it mean, reckless behavior? Okay, what does it mean? What does it mean? You know, I asked one question. What does it mean, you know, reckless behavior? This is the only scenario that the, you know, the top leadership that they can, or the top management they can punish. What does that mean, reckless? Asil, ahsant ya Asil. Negligence. Okay, behavior without taking responsibility, carelessness. Okay, Mansoor, thank you very much. Negligence, careless. Actually, you know, when we say about, you know, careless, when we say about, what we call it, you're having so many answers here, doing mistake and risky things. So reckless behavior is someone who is conscious, is oriented, his glaucoma scale 15/15. He said, I'm not going to do hand washing. I'm not going to follow, for example, the time, okay? I'm not doing, you know, I'm not going to do the, you know, to do triaging for patient. After you explaining the benefits and the things for, you know, for this staff, he's insisting not to follow. Okay, this is what we call it reckless behavior. Reckless behavior بالعربي بنسميه اللامبالي. اللامبالي. This is what we call it, you know, reckless behavior. يعني somebody is driving and you know, in Sheikh Mohammed Road, you know what the driving limit is? 100, and he is driving 200. Yeah, this gentleman is risky for himself and for others. This is the only scenario where we can punish people. You got it? So someone confer power to you when they depend on your important resources over which you have distraction that they are scarce, and status and power. Status, the extent to which others hold you high esteem and view with respect. This is a basis of power. Be aware those with the power, but to know status. Status is a self-esteem. Do you think your status and the power, do you think that someone, you know, he need, you know, let me, you know, I have one question here from one of you. You can just answer that. Yeah, by purpose. Thank you very much, everyone. We but you know, okay. Okay, thank you very much, everyone. Thank you very much. Okay. Okay. Now, person, a sense of power. An individual power can be understood only in relation to another individual of a group or, you know, of an individual. It's the perception of one ability to influence another person or people. This is the person's sense of power, consistent over time, but relationship specific, and may or may not coincide with actual power. Now, one of the things that I want to share, leaders, they want to control, and they want in the same time relationship with people. I can say for you, this is the needs for any leader. He want to control, and he want good relationship with people. Remember, ربنا بيحكي, God said, لست عليهم بمسيطر, correct? You cannot control people. What you can do, you can control a process. You can control policies, procedures, I mean, okay? This is one of the things. So you need to control process and having good relationship with people in order to make the change. You got it? This is one of the things that you need to have it in order to do the change. So to have good relationship and to control process. I'm talking about myself. I cannot control my kids. My kids, they are controlling me. Sometimes, when I enter the house or when I came to the house, sometimes I started preparing myself how to control, my tension. Or, sometimes I'm giving my kid money because I use it as adaptation techniques. Okay, boys always, girls they are better than boys. That's why I'm saying, the kids that are controlling us. Forget that. However, you cannot control people. The idea of that, you cannot control people. Okay, so this is the essence of this. Charisma. Can you give a definition of charisma? Anyone can give me a definition? What is the charisma means? What does it mean, charisma? Anyone have an idea what does it mean, charisma? Okay, okay, character. Okay, fine. What else? What does it mean, charisma? Unique characteristics of the person. شخصية مميزة. Character. جذب الآخرين لاستماع للكلام. Pharmacist Hussam. Okay, the ability to convince people and influence them. حضور okay. What else? What does it mean, charisma? I asked this one question. What does it mean, charisma? Enthusiastic manner with a connect people. Okay. فهد الغامدي اللباقة. شخصية قيادية جذب انتباه. Okay. الشيء الذي يميز الشخص. Good communicator. Character. You are right. Thank you very much. Now, charisma, charisma, as you mentioned, is something is very important. Charisma is something gained from the people. His charisma, his way of talk, maybe his way of walking, maybe because his nationality, having some certain charisma, making specialized to this person. In order to influence people, you need to have this kind of charisma. In order, talk with them, the way of talking. This is one of the things that it's, be in the. You mentioned something is, جاذبية شخصية. Yeah, it's one way of someone doing anything is unique and interested way. Yeah, self-confidence. قوة الجاذبية الشخصية. Yeah, you're right. يلهم الآخرين بشخصيته. That's great. Self-confidence. You are right. Thank you very much. كيف تعامل قائد متصل. Okay, that's the charisma. If does exist, it's likely an eye of behavior. Now, why do you think is important? Why it's important, guys? Why do you think charisma is important? Because we want to influence people. So you cannot influence people without having charisma, correct? So something is very crucial and very important to influence people and get their attention. We need to get their attention. So having their attention, you need to have someone having charisma. Yeah, this is essentially that's very very skilled communicators and individual who are both verbally elegant, but also able to communicate to the followers on a deep and emotional level. Charisma is skilled at addressing larger audience. Charisma is essential in time of crisis, able to motivate large group. Charisma is because the charismatic leadership depend on the personality and action of leader, not the process or structure. The person vision of the charismatic leader has the great deal of influence over his or her audience. Charismatic leaders speak about their moral compasses or passion rather than existing method of doing business. The personal vision of the charismatic leader has a great deal of influence over his or her audience. Now, case study to be, study. This is a case study. So I will leave you with this study, and then we are going to discuss, in more details. Okay. Just read this study. So do you want me to read it with you guys? Abdullah, he said, صاحب الكاريزما القوية إن لم يحاول أن يجعل منهم تحته يتعلمون السباحة من دون أن يساعدهم لن يكون لهم ظهور بوجوده. Yeah, I totally agree with you. Yeah. So let's start with this scenario because we need to know where things done wrong in this based on the culture of change. Okay, the case, this is resistance and new surgical suture in operating theater of the hospital. At the end of 2000 or 2014, a large university hospital in the Netherlands launched the procurement tender exercise for surgical suture material. The rationale for the hospital management to initiate this procedure was cost cutting and standardization. The award criteria were focused on the most economically advantageous tender. There were different suppliers on the market that were able to produce and deliver high quality surgical suture material for the lower price than was currently being paid. Consequently, the tender was awarded to a new supplier. The top manager and purchasing managers who initiated the tender trod carefully and implemented this relatively small-scale change initiative according to some basic change management principles, Culture 2012. They built guiding coalition that incorporated to renew the medical specialties. They consulted department heads and they communicated the change to the surgeon through different channels. Furthermore, it was recorded in the tender that the new supplier should provide value-adding services such as e-learning model for surgeon, facilitate a lengthy trial use period, and offer workshop and support to the operating theater. Hospital management convinced this is the first initiative as the test case for more expensive and cost-cutting operation that were to follow. The project was supported to the relatively easy both in scale and in complexity. However, in the preparation ahead of the trial phase, a concern was raised by the cardiac surgeon to the one part of tender package involving sutures specifically used for cardiac surgery. Nevertheless, surgeons were forced to participate in testing the products supplied in the whole tender, including those products used in their specific special. Meanwhile, the initiators of the project felt that careful preparation of the testing phase had been made. What went wrong in this scenario? As you see here, when in the middle of 2015, when this research project started, the hospital management eventually met with a first assistant from some of the hospital, the cardiac thoracic surgeon. They adamantly refused to work with the new suture material. The assistant took the form surgeon expressing anger at the management and stockpiling and their own supplies of surgical suture, refusing to operate and holding manager accountable for patient deaths that could arise from use the new suture and threatening to go to the press if such a thing indeed were to happen. Hospital management has anticipated some resistance, but not of this intensely. The end result was that the contract was eventually cancelled for sutures specifically used in the cardiac surgery. Now, what do you think happened? أحسنت أخي. نعم. أحيانا القادة المدراء يدخلون بين رؤساء القسم موظفيه ويحدث فجوة بينهم، وهذا خطأ المفروض للسلف الوظيفي. You are right, totally agree with you. عملوا تدريب. Yeah, what do you think? What do you think? There's, what would you think is happened in this scenario? Yes. Yeah, miscommunication, Fatima. I totally agree with you. What else? عبد الله he mentioned أدخلوا النوع الجديد تدريجيا. يدخل النوع الجديد تدريجيا. They supposed to to have it gradually. Yeah, I totally agree with you, Abdullah. What else? I need more participation from everyone. No participation. Hello? ما فهموا القواعد القديمة. اوكي، تدريب فرض الجديد اجباري احيانا. Yeah, you are right. It says forcing them, bringing professional trainer to learn them how to use the new material. Pharmacy Hassan, thank you very much. Doctor should be involved. Yahya, yes, you are right. Totally agree with you. From the beginning, they're supposed to have the cardiac surgeon involved. You are right. Yes. كل ما يعملوا بقاعدة جديدة تنفض حتى لو كانت الأفضل بالنسبة لهم. Okay. One of our colleagues here mentioned أتمنى أن كل مدير أو مسؤول قبل تعيينه كمدير عام يخضع لدورة مكثفة في التعامل مع الرؤساء والموظفين. As I mentioned earlier, people, they don't know what's their role as a leader or as a manager or as a director or as a hospital director. As I mentioned to you, their job is to care for people who are caring for people. We want to care for nurses, for doctors, for everyone. What's your priority is to care for your people and know how to deal with them. As I mentioned, if you have qualified people in leadership, because we mentioned earlier, who's the best to lead the organization, to be a businessman or to be a doctor. All of you mentioned both, and some doctors, some surgeons. We mentioned to have a qualified leadership, and the word of qualified to have a competency and patient safety and equality and management and budgeting and so on. So you cannot reach what you have and unless you have all of these things to have a qualified leadership. So again, I mentioned to you earlier, there is a businessman. I mentioned to this gentleman, a businessman who was leading one big hospital. He was very successful. Again, it's not necessary to be a good model, as I mentioned earlier, but sometimes what happens, I asked this gentleman, by the way, I asked him, is it a challenge to you to manage hospital? He said, if I don't know, I ask. Now, some managers or director, he answer without understanding. He didn't know. He don't want to know. He want to pass. Sometimes that's He mentioned to me, this gentleman, the one who businessman. He's American, by the way, was recruited by well-known company, John Hopkins. He said to me, if I don't know, I ask. And he said the big disaster or the disaster scenario, when I answer yes and it's really no, or when I answer no and it's really yes. This is the big disaster or big, disaster scenario that I faced at the beginning of my thing. That's why if you want to know how to manage people, this is something need training. You're right. I totally agree with you. Yeah, thank you, Abdullah. Abdullah. Ahsanti, Abdullah. Thank you very much. التحفيز نعم أحسنت. Thank you very much. Again, all of you, what you mentioned is totally correct. We are confronted with a numerous challenge. We have dramatically to cut the cost. This was an important test case because more and bigger cuts are pending. This appeared to us as an easy one. However, we have so many things, and you mentioned the head of operating theaters and all of these things. What you mentioned is totally correct. So not only with the surgical suture, but in general, medical specialists, this has changed. That is because of these suppliers have the powerful and very effective sales force. Again, you need to understand and consider this. It is what we call vendor lock-in. We call it purchasing manager. Jamaat al-Khair, if I mention this, we have so many things, especially in such scenarios. We have so many things is under the table. Under the table mean there is corruption happens sometimes, especially in the supply chain management. That's why we said we need qualified. This position is very critical in the hospital, and they underestimate it. If you understand me earlier when I mentioned we are, paying a huge amount of salaries, of money for so many positions, but for certain positions like supply chain management or the material director, we said no. So again, if you want qualified people, this position need really highly qualified people. So to run this business, to understand the language of doctors, nurses, and other people. So it's not about we need it's not about we need something is cheap in order to run our business. It's about how this item is safe with the patient. Is it meeting the objective? Is it meeting the outcome that we are looking for or not? We need someone who understands this language. We need someone who understands if there is, for example, a critical medication or an emergency medication is not existing. He understands why this is important and why we're supposed to have it always in the hospital. We need someone who understand this language and always who have it his priority. That's why, you know, some hospitals, they don't have this kind of qualified people in their position. We have corruption everywhere. That's why you will have the forcing, you know, to their items or for what they are looking for. So I hope it's clear. The manager that come up with idea to supposedly, you know, cut costs does not know that the suture cures and cures more or less depending on the brand. He does not know whether the needles are you know, round or angular, and he doesn't care. But for my work, this is very relevant. It has nothing to do with the professional autonomy. This is the cardiothoracic surgeon. Thank you very much, Mr. Abdullah. You know, I really appreciate your, you know, sharing such things with us. I totally, you know, agree with you, and thank you very much. I really appreciate it, Ahmad. Thank you very much for this. I really appreciate it. Yeah, yeah, yes, you're right. This is what we mentioned earlier about, you know, the things. So we would not just you know, I need to pass all of these things just only for your kind information. Already you discussed and already you mentioned in the chat box, so we're not going to be, you know, repeated. Chairman, we were, you know, this is about the medical supplies board and other things. Now, there are 6 key preparing for change. This is things that I need to finish this presentation with this part. Identify the change characteristics. Conduct the audience impact analysis. What kind of audience that you have? Do you have doctors, nurses, housekeeper as your audience, as their stakeholders? So we need to have, you know, audience impact analysis, assess the organization, assess the project risk, identify the special tackle for overcoming resistance, and present the strategy. All of these things is preparing for change. If you know this, then they will be done. Now I will leave you with this case study. This case study, and then we have you know, break for just 5 or 10 minutes. Let's say 10 minutes. We'll come back. We'll discuss this case, and then we'll start with the next presentation. Okay, I will leave you with that for 10 minutes, then we'll come back, inshallah. Thank you very much. Allah ya'tik alf af. Thank you very much for sharing this. Thank you very much. Oh, sorry. ان شاء الله احنا ظلنا ساعه يا جماعه الخير، وان شاء الله نخلص باذن الله. تعال طيب ظلنا ساعه ان شاء الله ونخلص باذن الله سبحانه وتعالى. Yeah, I asked this one question. This is the case study. So we are going to discuss this case study. So you have 6 minutes from now remaining. So in order to answer where was the incongruency and urgency. So we want to ask what could go wrong for this case study, and then we're able to discuss it in more deep, inshallah. Okay guys, so أنا ما راح أستنى عشان خلينا نكون إحنا على يعني to continue with this case study. Now, a large hospital group has decided in 2013 to build a new hospital and emergency department to increase the quality of services, especially the patient waiting times and you know, left without being seen. The hospital was fully operational in 2015. In 2015, okay. However, the patient waiting times and number of left without being seen (LWBS) actually increased in the ED in the emergency department and patients tracking score, along with the staff morale plummeted. In 2018, the management brought in consultant to identify the root cause of the problem. The construction alone rarely solves throughput troubles or the long-standing operation, the bottlenecks. Consultant realized that by trying to fix the problem, the management has changed already through groups of physicians. None of them were trained to work in emergency department by bringing the emergency department trained physician with timely and decision-making ability. The culture has changed as well as the quality of care. Walkout rate dropped and left without being seen rate dropped, and waiting time were reduced from 58 minutes to 19 minutes. Now, where was the the incongruency? Dana, she said, construction did not solve the problem. The bigger the emergency department, the more patients arrive, more skilled staff is answered. Okay, fine. In manpower training, now, if you think in this way, Dana, if you think in this way, bigger emergency department, more patients will come. But you might have as we mentioned, the bottleneck. We have patients is he's coming to to the emergency department, and they are stuck in emergency department. They're not going to there's something wrong in the emergency in the management and assessment. So we need to see that. Now, if you have a bigger room of the bigger emergency department, and the process inside of the emergency department is still complicated, is still not flows flawlessly, it may affect the smoothness of the emergency department. So we need to think in this way: where is the non-added value to the patient? What's the things this is actually, if you want to think in lean way, you need to think in this way. I need to think that where is the process that is non-added value to the patient, or where is the process that the patient is stuck in emergency department. And actually, the things that is mentioned here, there are so many people. If they train the emergency doctors or bring more experienced doctors, this will be okay. Yes, Abdullah. Thank you very much, Abdullah. Fine. And around, maybe 30 minutes, then we are going to finish. Maybe. I'm not sure. Thank you very much. Thank you. Hi, Aisha. Thank you very much, Aisha. Yeah. Yeah, you are right. All of you are right. So we have so many things. People, we need to know what is the root cause. For the patient, leave without being seen, or why there is too much waiting time. We need to see the process. What is the added value and non-added value, and not to have a bigger room as Dr. Dana mentioned. No. We need to think, lean thinking. The lean thinking talking about efficient doctors. Efficient doctor efficiency means efficient. To be efficient doctors means that you look to the time, you look to the effective doctors, that they are meeting their objectives when the patient arrive. You have, for example, triaging, you have prioritizing system in place. All of this will affect your change, correct? Yeah, you're right. You are right. Thank you very much, everyone. Uh, this is the, do people have the right skill to do the work? This is the model for the congruence model. This is for task people. Do people have the right skill to do the work? You know, one time, this is one of the things that you are, I want to share it with you, and non-utilized of talented people. You know, sometimes what happened, we have consultant, an emergency department in triaging area. You having consultant to triage patients. This is again non-utilize the right people and the right skills to do the work. This is waste again. Are they engaged in the work that is meaningful and motivated? Are they motivated to do the work? Now, are the people who need to work together able to coordinate? Do the compensation system support the work? So we have teamwork, we have innovation, and so on. Do the values of the organization support the task that we are going to do? Are the right people being selected for the firm? Are the people compensated in a way that motivate them? Are people needs met by the culture? Are their personal value? Are their personal value consistent with the value norms of the organization? Are the value of organization enforced by the formal organization? All of these things will affect the change. In summary, the congruence model is the tool of diagnosis or the diagnosing the root cause of an organizational problem. The fourth full description of the organization require you to not just to describe, but to analyze, search for incongruence. The congruence model is not the solution. It is an analytic tool for diagnosing the root cause of the problem that narrow the list possible solution. The multiple solution might address the root cause of the problem you identified. That's it. Now, this is for the summary. Now we are going for the last one with the leadership style. So I'm going to start with the next presentation after 3 minutes from now. Just give me time. I will prepare myself for the next presentation. That's it. Thank you very much. احنا بدنا من الان نص ساعة، بس نص ساعة ونخلص ان شاء الله. بس اعطوني بس دقيقتين بس بعد اذنكم اذا سمحتوا تكرمتوا. Just I need 2 minutes just to prepare ان شاء الله. Okay, 30 minutes ان شاء الله we'll finish ان شاء الله. I will try my best. Okay, so we are going to talk about empowering leadership orientation to power. So let's talk about the objectives. So we named the 3 levels in which power operate, and we will describe the 4 different models of leadership and identify and apply the qualities and skills of an empowering leadership. So this is the this is my objective. So we will have a presentation and brainstorming orientation to power, and we'll have participatory playground, 4 models of leadership, and we'll have a small group empowering the leadership skills and qualities, and individual writing my leadership commitment. This is what we are, talking about. What's come to mind when you hear the word of power? What comes to mind when you hear the word of power? As you mentioned here, the power is ability to act or produce an effect, correct? Power is often tied into the privilege based on one identity or position of authority. As example, for example, someone could be in a position of authority as supervisor, but may or may not hold a privilege in the institution or in the border of society based on their gender or identity, could hold herself from the power itself. Okay, so the word of power, as you mentioned, guys, here. Yeah, you're right. It's ability to act or produce an effect. This is the definitions of power. Fine. And we hear now from where the power is operate. So we have the power, it's operate from system, we have social, we have cultural, we have value, beliefs, and norms. We have interplay of political, policies, practices, and program from the institutional. And we have laws, policies, and procedures, and practices, and individual and interpersonal. Correct? Now, let me just take you one step forward about, that's a second, please. Yeah. Okay, now we have four leadership model. Yeah, we will just to talk about them all. The first, what does this model tell you or suggest to you? Or what kind of leader is this? What kind of leader is this? Anyone have an idea? What kind of leader is this? We okay. What kind of leader is? So what we call this leader? Okay. Okay. One man show, dictator. Yeah, you're right. One man show, weak leader. ضعيف متسلط الكل اتخذ واستمع. Okay, weak leader, leader B. We am. Thank you very much. Yeah. This is what we call that. Someone he mentioned only one. I need more answers, please. متسلط, autocratic. Yes, you're right. Autocratic. Yeah, you are right. This is the autocratic leadership style. Like me, I am talking and nobody talking to me. Okay, this is autocratic. Yeah, autocratic. He is the leader. He takes the decision alone, and everybody has to follow. It is not again, equality. Now, this is what we call it autocratic leadership style. He is the one who make a decision, and everybody need to follow. Now, the question is crossing my mind now. What is the advantage of this model? يعني جماعة الخير الآن كلكم جاوبتوا صحيح. It's autocratic leadership style. What is the advantage of this style? Autocratic leadership style. As I mentioned, this is a leadership style, is autocratic leadership style, is characterized by controlling by leader over the decision with a little or no input from the group members, correct? So the advantage, it can be beneficial when the decision need to be made quickly or without consulting with a large group of people, correct? This is one of the advantage that we are using this model. This model, yeah, there is no best style or best model in leadership. Every style or every leadership style have a certain situation that we can use it. For example, in the situation that are particularly stressful, such as during, for example, the military, or during the military conflict, or during the emergency, this style is the best style that we can use it. Now, what is the disadvantage of this style? Anyone have an idea? Yeah, you are right, everyone. Yes. The disadvantage of this style, the leadership does not encourage initiative. This style does not encourage initiative or creativity or personal responsibility from the group member. The leader who use autocratic leadership style when they are not necessary are often viewed as a posse, as you mentioned. They are controlling. They are dictatorial, and which can lead to the what we call it rehearsement for from the leader to the followers. Autocratic leadership can lead to the lack of a creative solution to the problem, which can ultimately hurt the performance of the group. Correct. This is one of the disadvantages of the autocratic leadership style. Now, I will share with you this model. What is this model talking about? Yes, anyone have an idea? Corporation. Oh, Allah, ya Muhammad. Parent. Yeah. And now we call that, paternalistic leadership style. Okay. The paternalistic leadership is based on the idea that the leader is a better position than the followers to know what is the best for everyone. Okay. Now, what is the advantage of this style? The paternalistic leadership style. What is the advantage of this? Yes, you are right. You are right, Hosni and Abdurrahman. Yes. What is the advantage of this style? يعني من احدى الشغلات الجميله بهذا النمط من القياده انه people who are in the followers role may want to be led by someone whom they perceive as taking care of them. يعني in the way that they want someone to care for them. Okay, this is one of the advantage of this the paternalistic leadership style. Now, the disadvantage of this style, if a wrong decision is made, the followers may become dissatisfied with the leader, correct? So this is one of the disadvantage of this style. I hope it's clear for everyone. Okay, what this style is talking about? Anyone have an idea? For me, this is one of the in the organization, it's the most frequent use. Let's say I use this style and every now and then. Anyone have an idea what this style is? Participative leadership. Hajar, she said participative. You are right. Participative leadership style. This is a participative leadership style is seek to involve other people in the decision-making process. So how much influence others are given, based on their preferences, beliefs of the leader. After the decision is proposed by either a group member or the leader then listens to the feedback and makes, the final decision. So the leader, he's not coming with a decision. No, he's asking the people. If you can see here, the member, everyone, give his opinion, give his agreement, give a suggestion, solution. So they share their thoughts. Let's say. Now, what is the advantage of this leadership style? Anyone have an idea? What is the advantage of this style? Problem, قائد ضعيف. يا جماعة الخير هون الادفانتج لهذا leadership is encouraging a group. of people to participate and share ideas and opinion, even though the leader retained the final say over the decision. Okay. Now, the group member feel engaged in the process. This is one of the things that the group, they feel engaged, they feel involved. Okay. Now, what is the disadvantages? What do you think? What are the disadvantages? All what you mentioned is correct, actually. I totally agree with you. Yeah, time consuming. يعني تخيلوا يا جماعة الخير when a leader يعني كان يعني he is asking opinion and discussion. Now, participative leadership can be shame when the leader asks for opinion, then ignore them, صح? Which will likely lead to the feelings of the what you call it, and we call it patriot. I don't know what's in Arabic, but it's not come to my mind. Yeah, they're not feeling patriot. What does it mean in Arabic, guys? Not come to my mind. Yeah, you are right. It will take time. You're right. Yeah, you're right. I totally agree with you. طبعا زي ما بتعرفوا هون ultimate decision is for the leader without whatever you decide, whatever you think, the ultimate let's say decision is for the leader here, correct? Yeah, you are right. Thank you very much. Yeah, Hawla, she said that. Thank you very much, Hawla. I really agree with you. Thank you very much. Thank you. You're right, guys. So what do you think about this model, guys? What this model is? I don't know if someone answering. الشخصية النموذجية decision making. أحس ولا واحد bring this. Didn't have a leader. Leads is fair. No دعاء. Leads is fair. Okay. ما في leader. Consultative, corporative. Yeah. This is empowering leadership style. This is empowering everyone. Now, why we say empowerment, or empowering leadership style, this is strengthening the leadership capacity for everyone and create circumstances in which everyone can participate, correct? Everyone, they can participate. Problems are identified and analyzed together. So everyone seeks the best solution for their organization, let's say. Actually, this style provides the opportunity for people to think and act and take initiatives and responsibility based on their own abilities, correct? This is one of the empowerment of leadership. Now, what are the disadvantages of this style? It's require high level of experience and skills, correct? You need someone who have experience and skills in order to have this style. Building a trust and relationship within the group can take a lot of time. If you want to trust them and take a decision from them, so it's like, it will take too much time to have this trust. So this is one of the disadvantages of this leadership. Now, as you said, empowerment is a process through which people gain greater control over decision and action affect their health. This is to expression of power. So power is often defined in a negative term as the form of domination. So, this is about the power. So the power is something is really very high, and we need to define between the power with, the power to, and power within. So this is what I have it here. Maybe here in the previous slide. The power is the best is love, implementing the demands of justice, and justice is the best is the power correcting everything that stands against love. This is by Martin Luther King. Okay, I will give you a scenario, and you will tell me which the scenario is talking about. Oh, this is explanation there. So here, a project manager is introducing a new program to their team. They have had several meetings with the leadership to try to get the resources needed to their team can do a good job and not to get burnt out of the process. The project manager comes to their team to provide the goal and activity, but doesn't want to pour their team with the details. They provide time to talk through the program, and the manager is interested in getting a feedback. However, the team has the feeling that the organization has already made the commitment to the move forward. This is what kind of leadership is. What kind of leadership is this? أحسنت حورة. This is yeah. What kind of leadership? This is Dana, autocratic. Yes, this is autocratic leadership style. You're right. So go to the next one, next scenario. Every Monday morning, our department gets together for a team huddle. Usually 10 people attend. It is the social and snacks are provided. So the department manager gives kudos to on the last week of success and goes through the list of activities and challenges that may come up in the new week. At least 15 minutes are set aside at the end of the meeting for question and answer. What kind of this leadership or this empowerment? Okay. Participatory, professional, participating leadership style. This is a participating leadership style. You are right. Number 3, a project is not meeting its goal or running late. The project manager send out a detailed email with a course of action that will put it back on the track. Later that week, they call a meeting with the entire team and an internal consultant to discuss a strategy to keep the project from running off the rails in the future. So what kind of, what the scenario is talking about? Mm-hmm. Anyone? This is, we are empowerment leadership. No, this is not autocratic. This is empowering, Sadadana. A project is not meeting its goals or running late. The project manager sent out a detailed email with a course of action that will put it back on the track. Later that week, they call a meeting with the entire team and the internal, this is, no, empowering. Yes, you're right. Number 4, the last one. 2 teams members have the personal falling out. This has caused attention to ripple across the team. The department, the manager talks to the each staff person individually and tries to get to the bottom of the story. However, they make it clear that the team members continue to disrupt the work environment. They could each be subject to disciplinary action. what this type of, what this scenario is. Anyone? Yes. This is what we call the patternistic leadership style. Again, okay, this is again from the scenario that we discussed earlier. We talk about the patternistic leadership style. We talk about the participative leadership style. We talk about autocratic leadership style, and we said that we don't have the best style. We done, Ustaz Salman. Thank you very much. Now, anyone have any question for me? So we'll have 15 minutes for question and answer. So just please in question and answer box, just please write your question there so I will answer it there. Don't write anything in chat box. If you have any question, make it in the question and answer. Yeah, we are done. Thank you very much, everyone. Thank you very much. If anyone have any questions, please, type it in the question and answer box, please. Thank you very much, Ahmed. Thank you. Okay, now Abdurrahman, he mentioned what is the relationship between the quality and cost and leadership. Okay, thank you very much, Mr. Abdurrahman. Actually, yeah, there is a relationship between the leadership and the quality and the cost. Now, first of all, what does it mean, quality? We need to understand what does it mean. Quality, doing the right thing from the first time, from the first time and every time, okay? So we need to, we understand that this is something is very crucial and very important. As a leader, we need, we need to be able to take a decision based on evidences, okay, based on data, based on قل هاتوا برهانكم إن كنتم صادقين, if I am a leader. And the cost here, the cost, I am not, going, decide about the things based on the cost. If it is high quality, means it will be high price. No, it's not necessary. It's not always. So we need to have what we call it return of investment, and think about efficiently. Now, think about it in this moment. Now, as a leader, if I start giving antibiotic in my emergency department blindly without taking, for example, swab to the patient, this will increase the cost, correct? So the patient will stay in the hospital more, and this is the patient will have resistance for antibiotic, so multi-drug resistance, and the patient will, instead of stay 1 week, he will stay 2 weeks. So I'm increasing the cost for the staffing. Think about it. We have staffing, we have doctors, nurses, and we have beds is already occupied with patients, and so on. So we need to think all of that things in this way. So if we think about it, so the leader is very crucial, very important, because he will take a decision. So so this is the way how we need to think. Okay. Another question: the leader can act based on situations, so we cannot individualize his character. You are right. I totally agree with you. Thank you very much. Okay. Any other questions? Any other questions? No, thank you very much. Thank you. طيب يا جماعة، اللي بده يطلع يطلع، ما في يعني الله معكم. اللي بده يطلع فقط أنا هون فقط للناس اللي بدها تسأل أسئلة. Thank you very much يا جماعة. الله يعطيكم ألف عافية. شروق, she's asking one question. How, she is asking كيف يمكن أن يكون الحل مع الموظفين المقاومين للتغيير بشتى الطرق. Involving them, just involving them. Yeah, involving them. This is a very crucial part in resistance. As we mentioned, if you're involving them, you will not have resistance. Okay, this is, and also empowering and rewarding them once there is a success happen. What is the secret of successful of leadership? The success of successful of leadership, first of all, as we said, to be honest. Walk the talk, Abdurrahman. Walk the talk. So you need to be honest. As we said, one of the exemplary leadership style is number one is to be credible. Credible means to be honest. To do what you say that you will do. We need walk the talk. This is one of the secret successful of leadership style. Yes. And to be a good listener, of course. All of the characters of leadership need to have it in order to be very successful, to be a good listener. Fine. Maybe tomorrow I can give you the chance to talk if anyone would love to talk, inshallah. Thank you very much, everyone. Thank you.